Good afternoon, everyone. I am Carlos Sainz, the Director of Regional Advisor on Bioethics at the PAHO WHO, and we are pleased to begin this virtual seminar on rethinking the concept of vulnerability in research. Before we get started, I want to give some instructions. This session will be entirely in Spanish, but we do have provisions to allow people to listen in English.
Want to listen to the presentations in English, please go to the little globe that says interpretation on the bottom right of your Zoom screen and click on English. If you don't see that little globe, just go to the circle with the three little dots and you'll find it there. So now we'll go back to Spanish. Bienvenidos a una nueva sesión de nuestra serie.
Welcome to a new session of our virtual seminar series on topics related to clinical trials. These webinars are jointly organized by the Regional Bioethics Program that is part of the Science and Knowledge for Impact unit of the Department for Action in Health of PAHO and the Unit on Quality and Regulation of Health Technology of PAHO, which is part of the Department of Innovation, Access to Medicines, and Health Technologies. On this occasion, we wish to remind you of some rules that will allow us to have a successful session. We will have a chance for discussion, and I would like to invite you to share your questions, whether they be in English, Spanish, or Portuguese, by using the Q&A box on your Zoom screen. You can use the chat to share your comments or any materials that you would like to share with the other participants. But we would be most grateful if you could please use the Q&A box at the bottom of your Zoom screen if you would like to ask a question to the speakers. I also remind you that no certificates will be issued for your attendance at this seminar. This session will be recorded, and the recording, as well as the recordings of previous webinars, will be sent through our mailing list on research ethics, and it's available on the bioethics website of PAHO, as well as our clinical trials portal. There, you can also see other resources and relevant publications for the conduct of clinical trials in the region, as well as our model contract for clinical trials. As we focus on today's topic, I wish to remind you that our last webinar of the year will be held on December 2nd. And this will be a reflection on ethics review and the potential use of artificial intelligence tools. We invite you to register on or sign up for our ethics and research mailing list to be informed of that in future webinars. Today's topic is very important for research. This is the concept of vulnerability. Over recent years, particularly since the publication of the CIOMS guidelines in 2016, we have been discussing a renewed understanding of vulnerability. But it has been a while since the publication of these guidelines. We see that there is still difficulty understanding this new concept of vulnerability, and also how this is different from how we understood vulnerability before. And also by implementing this improved and more refined concept of vulnerability is important when we look at ethics research related to research. So now we're going to hear a presentation from Dr. Florencia Luna. She is the person who developed this concept of vulnerability that the CIOMS guidelines are based on. I think that we are all familiar with Dr. Florencia Luna. She is a senior researcher at the CONICET and director of the master's program in bioethics at the Latin American Faculty of Social Sciences, Flaxo, Argentina, and also with PAHO WHO. So it is a great pleasure to have her with us today. Thank you for being here, Florencia. You have the floor. Thank you very much for inviting me to speak on this webinar. And I am going to speak on this topic that I've worked on so extensively, which is that of vulnerability. I would like to share the screen. May I have permission, please? Okay, it looks like I have permission. Where do I click?
Perdón, necesito, por suerte, estoy en Flaxo y tengo ayuda técnica.
Fortunately, I'm here at Fluxo and I do have technical assistance available to me. Yes, we're seeing your screen perfectly. Thank you very much. So I want to explain to you why it is important to have a proper analysis of the concept of vulnerability. And the other point I'm going to make is that many people believe that theory is not connected to practice. What I'm going to try to demonstrate is that this is not true. Some questions to ask ourselves. My presentation is structured around these three questions. Is the concept of vulnerability relevant? How is this concept applied in some bioethics and research ethics documents, and how should this concept be interpreted? To start, I'm going to show the two areas of analysis. One is the ethical and theoretical sphere, and the other is the ethical and political sphere. In terms of the ethical and theoretical sphere, we want to see how we should understand this concept. In the ethical and political sphere, we ask how this should be used. But if, in fact, we do not have a good theoretical analysis, we see that it is not strong enough and this concept cannot be applied properly. So once again, what is the origin of this word? It comes from the Latin word vulnerare, which means to wound or injure someone. And we also can see two dimensions of this word, as was proposed by philosopher Honora O'Neill. She indicates that people are persistently vulnerable at the same way that all species are and require protection through justice. And there is a second dimension. She says that people may become profoundly, variably, and selectively vulnerable because of the specific actions of others or institutions. So why is this distinction important? The first meaning of the concept of vulnerability encompasses all people. In fact, this is the concept that allows us to say that we are individuals that can die and that we have a natural vulnerability. It's an anthropological concept. The second meaning described by O'Neill, which gives rise to the term vulnerable groups that we're going to talk about in a moment, is much more specific. And this is what is relevant to research ethics and public health ethics. Now, when we use the first definition of the concept of vulnerability as an anthropological concept, it really encompasses everything. In other words, all research ethics could be understood in this way. Everything that we do when we're going to conduct a research project, we seek informed consent. It gets reviewed by an ethics review board. We do a risk-benefit analysis, and all of this has to do with the first meaning of the term. We are all fragile. If we're going to participate in research, we need to make sure that certain basic conditions that apply to all people will be in place. Now, what are we interested in? Not that framework of the concept or the anthropological definition, but when we talk about vulnerable groups, for example, we're looking at the second dimension proposed by O'Neill. In other words, that there are certain groups or individuals who, for example, need certain additional or special safeguards or protections. So this is perhaps part of why this becomes so difficult when we work with the term vulnerability. But let's move forward. So what is the traditional vision that we have worked with? This is based on the notion of a subpopulation. As Carla was saying, it's like that is being set aside. And why is this? Because generally speaking, when you talk about this, you talk about various subpopulations as vulnerable: ethnic minorities, refugees, persons with mental disorders. And we're going to see how that creates problems. And one example of this way of thinking, of that concept of vulnerability, are the ethical guidelines for CIOMS WHO research guidelines for 2002, which Carla mentioned. What do they say? Well, for example, it says that people with limited capacity to give consent, children, or people with mental disorders or prisoners are more vulnerable. But when we look at the other groups, and there are other groups or classes of person, people in nursing homes, those who receive social assistance, those who are unemployed, ethnic minorities, refugees, patients with incurable disease. So we could keep adding more and more groups. So what happens then? We begin to be subject to very strong criticism by renowned bioethicists such as Carol Levine, Ruth Faden, Christine Grady, Jeremy Sugarman, Lisa Eckenwiller, and they begin to question how this superpopulation of vulnerable people. And there is an article that I cite here in which they propose completely dropping that concept or minimizing it. But in fact, those of us who live in developing countries understand that it's not just that concept that's inadequate, but rather it seems like there are too many groups that are misunderstood and stereotyped, and this brings us to more specific criticisms. They reject the usefulness of the concept, calling it irrelevant, and say that in one way or another, we are all vulnerable. And this encompasses too many categories of people. And we run the risk of naturalizing vulnerable individuals or groups. And this gets back to what I was saying at the beginning. The two dimensions get mixed up, which O'Neill points out that it has to do with the relationship of the species, the intrinsic vulnerability of all peoples, and what it means to vulnerable due to specific circumstances. So this explains why a certain group of people may be profoundly, variably, and selectively vulnerable. So thus, what are some of these criticisms that were made? First of all, it essentializes the concept of vulnerability and makes the concept of vulnerability fixed. And it also stereotypes. This means labeling someone, and once you say that a given population is vulnerable, it is very hard to remove that label. And there is something there that gets us to label people. In addition, it has an idealized vision of the participant vis-a-vis the research, and then who is or is not vulnerable and a competent adult, somebody who can read and write. That would be like the model research participant. However, in reality, that's just an ideal. And we really do not work with ideals normally. Another problem that we have is that it may imply a mistaken identification. In other words, subpopulations or individuals who may or not be vulnerable and vice versa. So people may be mistakenly identified as vulnerable. And so this really impacts public health. Also, it is important to think about this from the other side. I always talk about misidentification with the example of my mentor, Ruth Macklin, one of the mothers of bioethics. When she turned 80 years old, sent out an invitation, a very sophisticated picture of her doing yoga, and she is a woman who continues to be brilliant, extremely intelligent, and has the comfortable socioeconomic means, a family that loves her. And in many regards, you might say that because she's an older person and she's past her 80th birthday, that she is a vulnerable person. But why should she be put into that category? So often there is something that we see that is not appropriate. And all of this is part of the problem. Of visualizing vulnerability in rigid categories. So what can we do in response to this criticism? Let's go back to the proposal with the two contexts of discussion, the ethical theoretical level and the ethical political level. Many of these criticisms are very valid in terms of ethical and theoretical sphere. And those who object to them are right when they see serious problems in this and that it has to be rethought. So, based on what we have discussed, it is necessary to A, recover the relevance of the concept of vulnerability, and also we need to provide a clear sense to avoid these criticisms. So this goes back to what I was just saying, that we have to rethink the concept. And this allows us to go back to the ethical, political dimension of this concept. In other words, if I have a good understanding of vulnerability, then I'm also going to be able to apply it properly. This is why theory does have an impact on practice. So, how can we understand this? And as Carla said, I have been working on this for many, many years. And so the first analyses that I did proposed that vulnerability was a dynamic and relational concept. So by approaching it this way, we looked at the scope of it and how it is conceived, and this is very much linked to the context and circumstances. I'll give you an example so that you can better understand what I'm trying to say. So this way of looking at vulnerability is different from a view that is just population-based. And why is this so? Because the population-based view talks about necessary and sufficient conditions. In other words, it's an all or nothing concept. Either you're vulnerable or you're not. Either if you're old, over a certain age, you're vulnerable. And the case of my beloved Ruth Macklin, it does not apply. You are or you aren't. So in this regard, you get into problems. My proposal challenges that rigid view. What do I propose? I would like to point out that we should think of vulnerability with the metaphor of layers of vulnerability. There are multiple different, and you can take them off layer by layer. There is not one single solid vulnerability that encompasses the entire category. Rather, different types of vulnerability can coexist. So this is a non-essentialist view. And now I'm going to give you another example to illustrate this. Women are not vulnerable just by being women. I hope that you can accept that. Now, a woman who lives in a country that does not respect her reproductive rights does take on a first layer of vulnerability, because if she becomes pregnant and does not want to or is not able to continue with the pregnancy, cannot end it. We know that in our countries, if this woman is of a middle class or higher socioeconomic level, then she will be able to interrupt the pregnancy safely. Obviously, it's not legal, but she would not endanger her health by doing so, generally speaking. Now, if it is a woman who comes from a lower socioeconomic strata, then she will confront another layer of vulnerability, and her interruption of pregnancy would not only be illegal, it would also be unsafe. And then there are many other layers in terms of how to access this. And if she's a migrant, she has another level. And if she does not have her papers, another level of vulnerability. She might not want to go to the hospital because she might be turned into the immigration authorities. So this concept of vulnerability has the characteristics I was telling you about. There are multiple kinds of vulnerabilities. They are different. You can go through them layer by layer, and they can overwhelm an individual and make them more and more vulnerable. There is not one single solid vulnerability, but rather there are many vulnerabilities that coexist. And this is also a more interesting understanding, because we see that it's not encompass the usual suspects. So it's not just the people that we always think are vulnerable are not necessarily vulnerable, or people might have a level of vulnerability. For example, we have physicians during the COVID pandemic. Generally speaking, we would say that physicians are not a vulnerable population. They've received an education, they have very important degrees, they are normally well situated in society. But during the COVID pandemic, and particularly in the countries that did not have enough personal protection equipment, and which was true of many of our countries and even in Argentina at the beginning, and in which was still no vaccine for them, they did have a layer of vulnerability. Now, normally we would not say that physicians are vulnerable, but just think how we are now using a different kind of language. They have a layer of vulnerability. It doesn't mean that they're totally vulnerable. So this way of understanding vulnerability addresses these challenges. Now, as I was saying, and since I've been working on this for a long time, once we went through this initial proposal, about 10 years later, I published a second very important article, which is the one that is cited at the bottom of my slide here, identifying, evaluating layers of vulnerability, a way forward. And some of the criticisms of my colleagues who were working with my concept of vulnerability, which is stratified or in layers or however you want to name it, but they felt that there still needed to be some kind of more concrete element that would make it easier to apply it in practice. And so what I was proposing was a concept that opened up vulnerability to many layers and it became a little bit difficult to use in practice. So they proposed a certain taxonomy, but then over time, well, in principle, I was against that kind of response. And so what I did was to rethink the concept, first developing two theoretical elements that I think are very important to bear in mind, and a practical two-step process that consists of first identifying the layer of vulnerability and then the evaluation of it. And I'm going to explain that now. Now, let's go back to the theoretical elements. What are the two theoretical elements that I propose to complement these initial analyses? First of all, we should bear in mind that there is a difference between the idea of vulnerable and those who have been violated or injured. And sometimes it's not as clear in English, but we have two related words in Spanish. So vulnerable is a person with a latent position which may begin to take effect, and in the end, the person is wounded or injured. In philosophy, this is a dispositional concept. For example, this means that a cube of sugar is solid, but it has the property of being soluble, and this is a dispositional property. That's a very interesting concept of dispositional. In reality, in order for this concept to be developed or to come into play, it is important to identify what are the stimulating conditions, or to say it in more colloquial language, what are the triggers that would unleash this solubility, such as submerging it in liquid. For example, if you have a cube of sugar and we think of its solubility, the stimulating condition is to drop the cube of sugar into liquid, water, coffee, and so it would dissolve. Now, the stimulating condition is what unleashes this property. In the case of vulnerability, that is precisely what's happening. We need to be able to identify what the stimulating conditions, or rather triggers, are that would unleash vulnerability, because we're going to look a little bit more at this. It's very important when we try to work on this in practice.
So this is our first concept. That is to say, let us think about finding those stimulus conditions or triggers for vulnerability. Now, second, there is another distinction that needs to be made, and that is that there are certain conditions or public policies or practices that we researchers may engage in during a clinical research project that may exacerbate existing vulnerabilities or create new vulnerabilities. So I call this like a cascade effect, or domino effect, because different layers of vulnerability are created over time. So I took the analysis of a term. Meeklange et al. Talk about pathogen sources, but they're still talking about these situations. So what I do is, rather than taking into account the source, like pathological in I focus
subrayar los
on
efectos
these domino
nocivos
effect
que tienen
vulnerabilities
y
and
denominarlas
highlight the
justamente etapas de
harmful
vulnerabilidad con efecto cascada
effects.
o
And
vulnerabilidad
so I
en
call it
cascada.
domino
Y en
effect
realidad, por ejemplo,
vulnerability layers
uno de los
or
casos que yo
cascade
tomo y
effect
explico
vulnerabilities.
es para
So one of
mostrar que
the
no necesariamente
cases
tiene que estar ligada a
I usually
situaciones
mention to
abusivas
illustrate that
o
it doesn't
patógenas,
always have to do
sino
with
que puede
abusive or
suceder en situaciones
pathogenic
mucho menos,
situations, but rather that they
sí,
can
menos
occur
desviadas, ¿no? Donde no haya
in
una mala praxis o
less
cuestiones por el
extreme
estilo, como puede
situations
ser
where
la falta
no
de
like
diagnóstico en el caso de
malpractice
enfermedades
exists.
raras. ¿Y por qué tomo esto?
And
Porque bueno,
I
en
take as an
realidad las
example
enfermedades raras, ustedes saben,
undiagnosed rare
son
diseases.
raras porque hay
Why do I
muy
take this?
pocos casos
Well,
de estas enfermedades.
because they
Entonces,
are rare,
es
because
como
there's
parte
very, very
cuasi
few
esencial
cases.
de estas
So
enfermedades que sea muy difícil
it
diagnosticarlo,
is
que no haya
very
un diagnóstico
difficult to
temprano y
diagnose these
adecuado, ¿sí?
diseases, and
Entonces,
there's almost no
¿qué
chances
es
of
lo que
having an
sucede? Bueno,
early and
la
accurate
falta de
diagnosis. So
diagnóstico
what
y
happens?
lo
Well,
interesante de las
this
enfermedades
lack of
raras
a
es que no es
diagnosis,
que
and by the way, what's
el
interesting about
pediatra
rare
o la
diseases
médica
is that
no,
this
no
doesn't
tuvo la
mean that the
información,
pediatrician or the
no lo
doctor
hizo correctamente, sino
didn't
que es parte
have
de
the
la
right
gran dificultad que
information or
tienen
didn't
estas
do their job
enfermedades, ¿no?
correctly,
Eso es
but
parte
rather
de
because of
esta,
how difficult these
de los
diseases are
desafíos que plantean las
to
enfermedades raras.
diagnose, and that's
Ahora
one of the
bien, la
main
falta de
challenges
diagnóstico en
these
enfermedades raras
diseases
puede
pose.
tener este
So,
efecto cascada.
lack of
Por ejemplo,
diagnosis in
muchas
these
veces
rare
estas
diseases may
parejas
have this domino
tienen
effect.
otro hijo o
So,
hija
for
que
example,
vuelve a tener
sometimes
la
couples
misma,
have a second
el
child
mismo tipo de
that has the
síndrome o de
same type
enfermedad.
of
¿Por qué?
syndrome or
Porque hay muchas de
disease
ellas que
as
tienen
their first one. Why?
características
Well,
genéticas.
because a lot of these rare diseases are indeed genetic.
Por otro lado, por ejemplo, el
On
hecho
the
de
other
no
hand,
tener un
for
diagnóstico
example,
temprano y
not
adecuado hace
having
que
an
se hagan
early and
tratamientos que
accurate
son
diagnosis
inadecuados, que, por ejemplo,
result in having
se pierda muchísimo
inadequate
tiempo, que, no,
uh,
que por
treatments
ahí
and
se
wasting a
lleve a
lot of
una
time,
situación peor.
which
Esto también puede tener
make the
consecuencias
situation
en
even more.
la dinámica
And this
familiar, cómo
could
afecta
impact, of
a
course, the family
otros hermanos
dynamics
o hermanas, a la pareja
and
misma.
other
Nosotros
siblings, the
sabemos
couple
bien
itself,
que en nuestros países,
because we know
cuando
that
hay un niño o una
in our
niña con
countries,
enfermedades, muchas
whenever
veces la
there's
que
a
termina
child with a
sola
disease,
haciéndose cargo de todo es la mujer,
oftentimes
que
the
tiene que
mom
ocuparse de
carries
esto, que
the
por ahí
brunt
tiene que
of the
dejar de
burden
trabajar para poder
and feels
hacerlo, o
lonely.
trabajar
Maybe
menos
she has
horas,
to
y
quit
esto,
her job to
entonces
take care of the
vemos cómo
child
se
or
generan un
work
montón
less
de
hours.
efectos
And you can see
cascada,
how all of these domino
efectos
effects start
nocivos a raíz de
appearing.
esto, ¿sí?
And these are
Ahora
negative
bien, un tema que
impacts.
siempre surge
Now,
con
there's
esto
an issue that
es,
always
bueno,
comes up
cómo
when I talk
justamente
about this,
pensar
and
estas,
that is
cómo trabajar acá y de
how
alguna
to
manera
work with these.
pasar a el segundo punto que yo les
And
planteaba,
with
que
that,
era
I will
el
move on to
de
the second point that I made earlier,
hacer un trabajo de identificación y por otro
which
lado un
has to do
trabajo de
with, first of all,
evaluación. Para esto yo
identifying
les
and then
dije
assessing.
que estos conceptos
So,
teóricos que estuve
I told
desarrollando
you
me parecía que
that
eran
all of these
importantes. Por
theoretical
un
concepts that
lado,
I
uno
developed
lo que
are
tendría que hacer
important.
es
On the one
identificar si
hand,
hay capas de
ideally,
vulnerabilidad.
we would need to
Para eso se
identify
pueden
whether
utilizar
there
diferentes
are
propuestas o definiciones,
layers
la de
of
Tanya Hertz,
vulnerability.
la de
For
Robert
that,
Macklin,
we can
digamos,
use
hay un
different
montón de
definitions by
propuestas
Hurst, by
distintas
Macklin, by Kipnis. There's different
y en
definitions that can
realidad
be used.
mi forma de pensar la vulnerabilidad
And
lo
the
que
way in
hace
which
es
I
más bien
think about vulnerability
pensar cómo funciona la
rather
vulnerabilidad
analyzes
y,
how
digamos, no tiene
vulnerability
ningún problema con
works.
definiciones diferentes o que se
And
contraponen, porque en
we
general
don't have a problem with
uno puede
different
pensar que hay diferentes
definitions
tipos de
because you may
vulnerabilidades
think that there are different types of
cuestiones
vulnerability.
que tienen que estar ligadas al
For example,
consentimiento,
everything that
a
has to
cuestiones que
do
están
with
ligadas con el
giving
nivel
consent
socioeconómico, o sea,
or social and
es como muy
economic
amplia la gama.
context. That
Entonces,
is to say, there's
diferentes
a
definiciones
wide
pueden funcionar.
range. So different
Por otro lado,
definitions cover different aspects, and
algo que
that
sí es muy
works.
importante es
On the other
identificar si
hand,
hay
there's something
alguna
that's
de
very
estas
important,
capas de
and that is to
vulnerabilidad
identify
tiene este
whether
efecto cascada.
one of these
¿Por qué?
layers of
Porque vimos que era
vulnerability
muy
have
nocivo,
this domino
porque
effect.
genera
Why?
un
Because
montón de
it
otras
creates a
vulnerabilidades.
snowball effect that can
Y
be
finalmente,
very bad. And finally,
el otro concepto teórico que acabo de
The
desarrollar
other theoretical
también es muy
concept that I
relevante.
explained is
Identificar,
also
ver
highly
si
relevant,
hay
and that is to
condiciones estímulo o
identify whether
gatillos y en qué
stimulus
consisten.
conditions
Entonces,
or
una vez que yo
triggers
más o menos
exist and
identifiqué
which ones they are.
eh,
So
las
basically,
capas de
I pretty much
vulnerabilidad, si
identify
tienen
the
un
layers of
efecto cascada, si
vulnerability,
hay
whether or not they have a
condiciones
domino effect,
estímulo o
whether there
gatillo,
are
vamos a pasar al
stimulus
segundo
conditions
paso,
or
al
triggers.
segundo
And with that,
punto,
we're going to move
que
on
es
to
el
the
de
second
evaluación.
step, which is the
¿Y
assessment.
qué vamos a hacer entonces? Primero, un proceso de
And here,
priorización de
first of
mayor
all,
a
we
menor
need to
daño, porque para él no
prioritize
todas
from
las
most to least
vulnerabilidades
harmful
tienen igual
because
rango y
not all
además por ahí no puedo
vulnerabilities
resolver
have
todo,
equal
entonces tengo
weight,
que
and
empezar a
also I
pensar
may not always
realmente
be able
cuáles
to
son
address all of
las
them. So, for that, it is very important
capas de
to
vulnerabilidad o las
prioritize
vulnerabilidades o las
these
situaciones de
layers of
vulnerabilidad que plantean
vulnerability
eh, mayor daño. Y para eso
to
nos
address
sirve
the most serious
considerar
ones
el
first.
efecto
And for
cascada,
that,
que hemos
we
dicho que
need
era
to,
súper
first of all,
nocivo,
take into account this domino effect
capas de
that we said was
vulnerabilidad muy
negative,
dañinas, por ahí no
also
tienen un efecto
very
cascada, porque
harmful
bueno, provocan la muerte,
vulnerability
por
layers that
ejemplo,
may
y
not
pensamos,
have a
bueno, hay más
domino effect,
efecto
but
cascada,
they trigger
pero
death.
es hiperdañino
So it's
o muy
highly
probable.
harmful or highly likely.
Y sobre todo que sean muy probables, que se vayan a dar.
That is to say that
¿Cómo?
they are that more
Justamente a
likely than
través de las
not they will
condiciones
happen.
estímulos. Tengo que buscar a ver si hay
How?
esas
Through these
condiciones
stimulus
estímulos, esos
conditions or triggers.
gatillos
I have to
que
see
las van a
whether or not those
desencadenar, que las
triggers
van a actualizar,
exist
¿no?
that
Habíamos dicho
will
que eran,
activate
estaban como
those.
latentes, que la
I
vulnerabilidad está
said
latente y
earlier
que se
that
puede
vulnerability is like a
desencadenar o no.
latent condition that may
Y
or
para
not
eso,
be
además, tenemos
triggered.
ciertas obligaciones.
And
En
for
primer
that, we
lugar,
also have a
evitar
series of
exacerbar capas de
obligations.
vulnerabilidad. Si
First of
nosotros como
all,
comité de
we need
ética vamos a
to
recomendar algo o vamos a
refrain
aceptar
from
que es una
exacerbating
determinada
layers of
investigación, tenemos que
vulnerability.
ver que
As an
no
ethics
exacerbe capas de
reviewer, we need to
vulnerabilidad.
make sure that
En
research
segundo
does not
lugar,
exacerbate
vamos
these
a
layers of
pensar en
vulnerability.
erradicar, digamos,
Second, we need to think
ciertas
about
capas
eradicating
de
certain
vulnerabilidad. ¿Sí?
layers of vulnerability.
Pero a veces no se pueden erradicar. Por
But
ejemplo,
sometimes we
cuestiones que están
simply cannot do
ligados
it.
a
For
medios,
example, everything
digamos,
that
sí,
has
a
to
la
do
situación
with the
socioeconómica es muy
social and
difícil de
economic
erradicar.
context
O
will be
recién
very
cuando hablábamos de
difficult to
interrupción del
eradicate.
embarazo,
Or,
me
for
parece
example, when I
sumamente
just gave an
ilegal
example
y es
of,
muy
you know,
difícil erradicarlo con
interrupting
tiempo.
or
Entonces
stopping a
vamos a pensar
pregnancy
en minimizar estas
in
capas de
certain countries, it's
vulnerabilidad.
very
¿Cómo?
difficult. So we need to think
A
about
través de
minimizing
estrategias como
rather than
pueden ser
eradicating these
salvaguardas,
layers of
protecciones,
vulnerability.
pero
And how do we
también
do that? Through
empoderamiento. Y esto viene
safeguards,
también de la
protection, but
mano del
also
feminismo
empowerment.
que
And this goes hand in
pone el
hand with the
acento no
feminist
solo en proteger, sino
movement,
también en
which
empoderar. Y esto es muy importante y yo
highlights not
también
only
lo
protecting, but
retomo.
also
Y le voy a dar
empowering,
un
which is
ejemplo
also
para
very
que,
important.
porque creo que estoy
And I'm going to
llegando, voy
give
a
you an
llegar bien
example
con el
because
tiempo que me viene.
I think I'm reaching
Podemos
the end of the
pensar en
time
una
that was given to me.
investigación que
We can
pueda llegar
think
a tener
about a
efectos
research project
teratogénicos si
that
las mujeres
may
se quedan
have
embarazadas. ¿Sí? De
carcinogenic
vuelta, volvemos al
impact if
problema de se
women
quedó
get
embarazada,
pregnant. We go back to the
el
issue.
feto
This woman
puede
is
ser que
pregnant,
tenga, digamos,
and the fetus
serios problemas cuando
may
nazca y esta
have
mujer
serious issues
quiere
when
acceder a una
born,
interrupción del embarazo, cuando
and
esto
this
está
woman therefore
prohibido.
wants to
Bueno,
terminate the pregnancy, but it is
por un lado vamos
banned
a ver
in her
que
country.
el quedarse
So, on the one hand, we will see
embarazada en esta
that
situación,
getting
participando de
pregnant
un
in
protocolo
this
en
situation,
donde,
as part
digamos,
of a
existen
protocol
riesgos
where there are
teratogénicos,
certain
tiene un
pathogenic
efecto cascada.
risks, has
Si ella
indeed a
decide
domino
continuar con el
effect.
embarazo
If the
y
woman
después
decides to
nace un
continue with the
bebé
pregnancy and then
con
she
serios
has a
problemas
baby
a raíz
with
de
very
esta
serious problems
investigación,
as a result of this research
esto,
project,
digamos, va a tener este efecto cascada, va a ser un
well, there
bebé
will
con
be a
problemas,
domino
que
effect. This
un
baby
poco
is going to
parecido a lo
have
que
a
yo les
lot of
estaba
problems,
relatando
and it
respecto de
will
la
be very
enfermedad rara,
similar to
¿no?
what I said
Eh,
before when I
que
talked about rare diseases.
se va a tener que ocupar, que por ahí
This woman
la
is going to
pareja
have
la
to
abandona, que va a
take
implicar
care of this
quizás que no se
baby.
pueda
Maybe her
ocupar de sus
partner
otros hijos,
will
que tenga que
leave
trabajar
her. She may
menos
have
horas para
to not
poder
pay
hacerse cargo
as
de
much
ese hijo
attention
que
to other
nació con
children
problemas,
or work
etcétera,
less
etcétera,
hours so
etcétera.
she can take
Si
care
ella
of this child
decide
that was born with
ir
serious
a
problems,
una
etc.
interrupción del
Now,
embarazo,
if she
sabemos que va a
decides
ser
to terminate
ilegal y
her
que puede
pregnancy, we
terminar
know
en
it's
algunos
illegal
casos presa,
and she may end
muerta,
up in
digamos, por
jail
el
or
aborto, depende de las
dead
condiciones en las que se
because
haga, o con
sometimes
serias
abortions are
lesiones,
not performed
infertilidad,
in the
etcétera, etcétera.
best
O sea, también
conditions
tienen
or
una
other
serie de
issues like infertility
consecuencias
and other
terribles.
problem. So there's another series of
bien,
very terrible potential
lo que tenemos que
consequences.
ver es, por un lado,
So we
bueno,
have to
tratar de
see, on the
erradicar
one
esto, pero
hand,
como decía hace un rato, bueno, es muy
how we
difícil
can eradicate
erradicar
this. But like I said a little while ago, it's very
esta
difficult
capa de
to
vulnerabilidad que tenemos en
eradicate
los
or
países
eliminate
donde esto
this layer
está
of
prohibido.
vulnerability where
Entonces, ¿qué se puede
terminating a
hacer? Bueno, pensar
pregnancy
en
is
minimizar esta
illegal. So
posible
what
capa
can
de
we do? Well, we
vulnerabilidad.
need to try to
Y en general lo que
minimize
se hace es, por
that
ejemplo,
layer
proveer
of
un doble método
vulnerability. So,
anticonceptivo, ¿no?
for
Entonces,
example, we provide
proveer un doble
double
método
contraceptive
anticonceptivo de manera
methods
tal de que la mujer,
just to
por
make sure
ejemplo,
that the
se
woman, for example,
cuide, pero también podemos,
can
y estas serían las
be
salvaguardas que yo
protected.
les puse
And
ahí,
these are the
¿no? O sea, las
safeguards that I
protecciones.
mentioned
Les vamos a
earlier.
brindar
That
a
is to
estas
say, all this
mujeres
protection that we're
doble
going to give
método, pero
women, like
además las
this
vamos a
double
empoderar,
method,
les vamos a explicar
will
que es
be
importante que no se
empowering
quede
for them
embarazada
because we're going to
durante la
explain to them
investigación.
that it's very
Le vamos a
important for
enseñar
them not to get
probablemente,
pregnant during
porque por ahí
research.
no conocen bien su
And
salud sexual
they may
y
not know a whole
reproductiva,
lot
entonces
about
cuándo se
sexual and
pueden quedar
reproductive
embarazadas, que si en
health,
algún
so we
momento
can
tuvieron
explain to them
relaciones
when they may
sin
get pregnant
protección y pueden
that it's at
acceder
some
a
point
una píldora del
they
día después, o sea,
have
cómo se va a hacer el estudio,
unprotected
¿sí?
sex, they can
Con
have
esto, ¿qué vamos a
access to
hacer?
the day
Bueno,
after pill, etc.
minimizar las
So
capas
what
de
does that do?
vulnerabilidad y decir,
We're
bueno,
trying
se
to
puede hacer
minimize
esta
these layers
investigación.
of
Ahora
vulnerability and
bien,
say, okay,
si
we
por
can
ahí
go on
estas
with the
mujeres
research
sabemos que
project.
están en una
Now,
comunidad en
we
donde es
know
muy
that these
común el
women live in a
alcoholismo o que
community
sus
where
parejas sabemos que son muy
alcoholism
violentas y que
is
van a pensar
common.
que si las
Some
mujeres
partners are
están
very violent,
cuidando
and
y
the men are
utilizan
going to think that if women
distintos métodos
use
anticonceptivos, las
protection
están
and
engañando
different
y esto va a llevar a
contraceptive
que, no
methods, it's
sé,
because they're cheating on them,
les
and
peguen
that
o
in
que
turn
genere
will
problemas.
have
Y
them
bueno,
beat them
si fuera esta la
or
situación,
abuse
uno
them
dice,
in
bueno,
other ways.
realmente
If that's the
acá, con
situation,
esta
we can say,
población, no
okay,
podemos
well,
realizar la
honestly, in this
investigación,
case,
en esta
and with
situación en
this sector of the
particular,
population, we
¿no?
cannot
Entonces,
go ahead
ahí
with that
podemos
research
ver de qué
because
manera
of the context. So,
identificamos
in that
primero
case, we
cuál
need to
puede
see how
ser
we,
la capa de vulnerabilidad. Vemos
well, like I
algunos
said, first
efectos
we identify
cascada que
the
es muy
layer of
dañina, que es muy
vulnerability. We
probable.
see that
¿Cuáles son las
it's
condiciones
very
estímulo?
harmful,
Que
highly
sería
likely,
evitar
what
que
the
quede
stimulus
embarazada,
conditions are, that is
buscamos
to say, to prevent pregnancy in this case.
minimizar, porque no podemos
And with that,
erradicarla,
since we cannot
minimizar,
eradicate
exacerbar
this
esto,
vulnerability,
y lo que
we need
vamos a
to
hacer entonces
avoid
es
exacerbating
a
the issue
través de
and
estas
rather
distintas
mitigating
estrategias
these layers of
em,
vulnerability. So
brindar
through
ciertas
different
salvaguardas
strategies,
o
we provide
empoderar
safeguards and
las personas
or
que están
empower
participando
the
de la
women
investigación.
that are part of our research project.
¿Cuál es el impacto de esta propuesta?
Now,
Bueno,
what's the
los
impact of
primeros
this
análisis que
proposal?
yo hice,
Well,
que
my
fueron
initial
de
assessments,
índole
which
ético-teórico, porque
were
todos estos
ethical and
últimos estudios los
theoretical
publiqué
in nature,
en el 2019, o sea,
because I
relativamente reciente,
published all of my work
impactaron
in
no solo en citas de
2019, which is
prestigio
quite recent.
y en
So
general
they impacted not only
tiene como,
renowned
fue publicado, sobre todo
bioethicists,
el primer
but
artículo
also,
fue
especially the
publicado
first article, was
en una de las revistas
published
feministas más
in
importantes
one of the most
en el
important
ámbito de la
feminist
bioética, así que
magazines
también
in
impactó mucho
bioethics.
al pensamiento feminista y
So
tiene que
it
ver, digamos, con esto.
it
Después
was it
seguramente alguien me va a
closely
preguntar por la
it was closely linked
interseccionalidad,
with the feminist
y en
movement. And
realidad vamos a ver
somebody's going
que
to
tiene
ask
muchos
me
puntos de
about
contacto, muchas
um,
semejanzas, son el mismo
cross-cutting
activismo, ¿no?
issues, and you will see that there's
Pero
a lot.
también que quizás esto les interese a ustedes más, en
And
las dos guías de
maybe
ética
you're
de la
interested that
investigación
in
como
the
más
two
relevantes
bioethic
internacionalmente. Las pautas
guidelines
éticas internacionales para la
that's
investigación
included. That is
relacionada con la
the
salud en seres humanos de
international
la OMS y la OMS,
ethics,
esta
the
que refería
SIOMS
Carla, la del 2016,
WHO
y en la declaración de
bioethics
Helsinki.
guidelines, and also the Helsinki
Entonces, ¿qué es lo que
Declaration.
vamos a ver? Que
So, what are we going to
en las
see?
guías de la
Where
OMS
we see that in the
del
SIOMS
2016
guidelines from
eh,
2016,
se señala explícitamente
it
que un
explicitly
enfoque
says
tradicional ha
that
sido
a
calificar a
traditional
clases
focus
enteras de
has
individuos
been
como
to
vulnerables y va a
classify
decir
and turn on
explícitamente la noción de
individuals,
vulnerabilidad
classes
en
of
esta pauta
individuals
procura
as
evitar considerar
vulnerable.
vulnerables
And
a
it
los
says
miembros de
that
clases enteras de
the
personas.
account of vulnerability in
Y
this guideline seeks to avoid
en este
considering members of
artículo
entire
del
classes of
Journal of
individuals
American
as
Medical
vulnerable.
Association,
And in this article from
se
the
presenta en donde
the
tanto Hans van Delden
JAMA,
como Rite van der Graaf, que son
Van
el
Delden and
presidente y la
their
secretaria
Graf,
general de
which
la
are the
Acción por el
President and
Momento,
Secretary General of SciEMS at the
explican cuáles
time,
fueron los
we
cinco
see
o
that
seis
they
cambios que
explain the 5 or 6
más
changes,
importantes en
the
la
major
versión del
changes that they
2016.
introduced in the
Hablan
2016
de que uno de ellos
version.
es el de la vulnerabilidad
And it
y
says that one
citan
of them is
una trinomia, o
vulnerability,
sea que no me estoy atribuyendo
and
malavidamente influencia, sino que efectivamente fue así. Porque,
that
y ahora
is
les voy a
actually
leer parte de lo que
case.
dice,
They
no se
included
usa
one of my
obviamente la
articles.
noción de capas,
Obviously,
porque como les
we
dije al
don't
principio es
use
una
the notion of
metáfora.
layers because, like I said at
Ellos
the
lo
beginning,
que
it's a
señalan y
metaphor.
dicen es, sin
But what
embargo,
they do
resulta de
say
utilidad
is
considerar
that it's useful
las características específicas
to
que pueden
can
hacer
look at the
vulnerables
specific
a una
characteristics that
persona.
may
Y van a
render
decir, también
individuals
pueden
vulnerable.
coexistir diferentes
And it says
características
that
que
different
hacen que algunos
characteristics may
individuos sean
also
más vulnerables
coexist,
que
making
otros.
some
Esto
individuals more
depende en gran
vulnerable
medida
than
del
others.
contexto.
This is
Entonces, esto
highly
es lo mismo que
dependent
yo les
on the
venía contando,
context. So
¿no?
this is the same
Por
thing I was
ejemplo, las
mentioning
personas
before. It
analfabetas, las
goes on to
personas
say, for
marginadas
example,
en virtud
persons
de
who
su
are
estatus
illiterate,
social o
marginalized by
comportamiento,
virtue of
o
their
aquellas que
social
viven en un
status or
ambiente
behavior, or
autoritario,
living in
pueden
an
enfrentar
authoritarian
múltiples
environment
factores
may have
que las
multiple
hacen vulnerables.
factors that make them vulnerable.
Entonces, si bien no se usa la
So
terminología de
even though
las capas,
they
porque
don't
obviamente es
use
una metáfora y es algo un
layers,
poco
because
raro
obviously,
en
like I
un
said, it's a
texto de ética
metaphors,
de la
and that will be
investigación, se
kind of
utiliza este
weird to
mismo
read that
análisis
in
conceptual que yo les
a
vengo
scientific
relatando.
article. It
Entonces, en
does
ese
use
sentido,
the same concept that I've
ahí
been describing.
claramente aparece esta
So in that
noción de
case, we
capas de
clearly say that
vulnerabilidad
they
o
refer to these layers of
vulnerabilidad
vulnerability,
estratificada, como se quiera llamar.
or I don't know, tiered
Y en la declaración
vulnerability.
de Helsinki vamos a ver cómo, por ejemplo,
And
la
then
versión
in
del
the Helsinki
2013 le dedica
Declaration,
el
we can
parágrafo
say that
19 y
the
20
version
al
from
concepto de
2013
vulnerabilidad y los denomina
uses
no muy
paragraphs
claramente como
19 and
grupos
20
vulnerables e
to
individuos
the concept
y
of
utiliza la
vulnerability,
propuesta
and
tradicional. Pero la
it
versión
uses a
última, la del
traditional proposal.
2024, especifica en
And
el
that sector is
apartado, en el
called
párrafo 19,
vulnerable groups and individuals. But
un
then the
poco más
version from
específico.
2024
Algunos
in paragraph
individuos,
19
grupos y
says some
comunidades están
individuals,
en
groups,
una
and communities
situación de
are
mayor
uh,
vulnerabilidad
in a
debido a
situation of
factores, de
higher
vuelta, toma un
vulnerability due
poco
to factors,
el modelo de la acción, ¿no?
again,
Que
this
pueden ser fijos o
copies
contextuales y
SIAMs that may be
dinámicos.
fixed,
Y en
context-based,
realidad
and
acá
dynamic.
también, digamos, en este caso, yo participé
And in this case,
en una de las,
I was
ellos hicieron
also
varias consultas
involved in
sobre los
the
distintos puntos que
consultation
iban a
process. They
modificar y
held
una de ellas
different
fue
consultation rounds,
justamente la
and one of
de,
them
que es la de
was
vulnerabilidad, que se hizo en
on
mayo del
vulnerability. That
2024,
took place in May
a la que me invitaron y en
2024.
donde yo hablé de
I
esta
was
concepción.
invited
Así que ellos
and I talked about
toman
all of
esta
this.
idea
So they
y
took
hablan de
this
situaciones de
idea and
mayor o
they talk
menor,
about
digamos, vulnerabilidad. Si
higher
bien
or
todavía
lower
quedan
vulnerability
estos factores
situations
fijos,
or contexts,
pero por
even
lo
though
menos
they still
incorporan
talk
esta
about
idea
these
de
fixed
que pueden ser
factors, but at
contextuales y
least
dinámicos
they
y
say they
empiezan
may be
a modificar
context-based
la forma
and
de
dynamic.
pensar la
So they
vulnerabilidad.
change a little bit.
Bueno,
They ch-
entonces
they
esto
they
tiene que ver un
slightly
poco con el
change the
impacto
concept
que
of
tuvo
vulnerability, and this has to do with
esta propuesta, un
the
poco también lo
impact
que
this
decía Carla al
proposal
principio.
had. And this
Y
goes
ahora
back to what
querría
Carla was saying
terminar
at the
ya
beginning.
con dos o tres
But now I
transparencias
would like to
hablando de los
conclude with 2
beneficios
or
que yo
3
creo que
slides
tiene esta
talking about the
propuesta.
benefits of this proposal.
Por un lado, tiene en cuenta el contexto.
First, it takes the
Y
context
vamos a ver
into
esto que les
account.
decía hace un rato, ¿no? A veces
And this goes back to
personas
what I
que
was saying
normalmente no
earlier.
consideramos vulnerables
Sometimes
pueden
people
llegar a
that we
serlo, pueden llegar a
oftentimes
tener una de estas
don't think
capas de
about
vulnerabilidad.
as
Entonces, como les
vulnerable
contaba el caso
may
de los
have
médicos y las
added
médicas
layers
en
of
etapa de
vulnerability,
pandemia.
like I
Y en
said, the
algunos
doctors
países,
and
porque había
nurses
otros
during the
países
pandemic,
entonces
and in
que
some countries,
tenían equipos
because
de
there were
protección
some countries that
adecuada y que
did have
tenían y que
personal protection
consiguieron
equipment
rápidamente la
and
vacunación en donde
were
esto no se daba.
quickly
Entonces,
able
el
to access
contexto
vaccines,
es
and so that
fundamental y esta
vulnerability was not
propuesta
as
lo
high.
tiene en
So the
cuenta.
context is key, and this
A
proposal
la vez
takes
es
context into
flexible y
account.
dinámica
At the
y
same
esto
time,
que yo
it's
les
flexible and
mostraba recién,
dynamic.
una vulnerabilidad
And like I
puede
showed you a few
erradicarse
minutes
o
ago, a
modificarse
vulnerability
Entonces nos saca
may
de esa visión
be
que vimos al
eradicated
principio,
or mitigated.
esencialista, que
So this takes
estereotipa,
us
que
away from
fija, que
this
pone un rótulo.
initial view that is
Evita
more
manejarse con
fixed.
preconceptos y estereotipos.
It
En ese
doesn't take
sentido,
into
esto
account
también es, digamos,
preconceived
muy
concepts,
importante.
concepts and
Estimula el
stereotypes, which is also
pensamiento
very
crítico y
important.
la
It
deliberación.
stimulates
A mí
critical
me parece,
thinking
y en esto
and
coincidimos
discussion.
con Carla, en que es
Carla and I
importantísimo,
agree on
digamos,
this, and
salirse
that
de
is
las
that
listas
it's
de
very
chequeo
important
y
to
decir, bueno,
get away from
autonomía,
those
esto, lo otro,
checklists and
y
say,
pensar que con eso resolvimos el problema,
self-sufficient,
sino
etc.,
más bien
and
esto
thinking that that takes care
nos
of this,
invita a tener un
but rather
pensamiento crítico
we
y de
need to
deliberación
have
y ver
more
efectivamente qué pasa y cómo
critical
está afectando el
thinking
contexto
and see
determinadas
how the
personas,
context may
poblaciones,
impact
grupos o individuos,
individuals,
¿no?
sectors
Y
of
a
the
la vez
populations,
refleja
or
más
groups.
claramente lo que
And at the
sucede
same
en la
time, they
realidad.
are a more clear reflection
No
of
pone corsets
what is
teóricos,
happening
sino que justamente nos invita a
in
pensar
reality. This is not
que
a
pueden aparecer
theoretical concept,
vulnerabilidades
but
que
rather
no las
it
habíamos
forces
pensado
us to
antes, ¿no?
think
Y que
that
el
certain
contexto, la realidad
vulnerabilities may
nueva,
appear that we
situaciones
had not taken into
novedosas
account
pueden llegar a
before.
generar.
So new situations may make
Y
some
por otro
vulnerabilities
lado,
appear.
a mí me parece que es interesante porque
I
tiene en
also think
cuenta
it's
la
very
fuerza
important
normativa de los
because it takes
daños devastadores e incrementales que
into
tiene el
account
efecto cascada.
the
Por otro lado,
normative
claramente
strength
podemos tener
and of the
y
devastating
especificar, digamos, distintas
damage
obligaciones.
and
Hablamos de no
domino effect.
exacerbar,
We talk
erradicar,
about not
minimizar
exacerbating,
vulnerabilidades.
eradicating,
Mantiene
mitigating
la flexibilidad de las capas
vulnerabilities.
que,
So
por
this
ejemplo, cuando
main
uno
keeps
trabaja con
these
taxonomías la
layers
pierde y por eso
flexible,
es lo que están
which
en
when you
contra,
work with
y
taxonomies,
concuerda entonces
you
con la
don't have.
realidad de las capas de
And what we're
vulnerabilidad y esta
doing
flexibilidad que nos mantiene,
matches
que yo estaba señalando, y
reality and
finalmente
vulnerability
ordena las
layers. And
capas de
finally,
vulnerabilidad y
it
permite pensar
prioritizes
en
these
cuáles
vulnerability
se debe
layers and
priorizar más
allows us to think
fácilmente. En ese
about which
sentido,
ones we should
a mí me
focus on
parece
first.
que esta
So, in that
propuesta
sense, I believe
eh, es, digamos,
that
logra
this
resolver parte del
proposal
problema práctico
addresses
que
part of the
teníamos al principio.
practical problem we had at the
Y
beginning.
bueno, habiendo dicho esto,
Well,
les
having
agradezco
said
la
all
atención,
this,
espero haberlos
thank you so
convencido y
much for
vamos a
your
escuchar
attention.
a
I
las
hope
otras personas que tenemos acá
that
en la
I
mesa. Muchas
convinced you,
gracias.
and let us hear from the other
Muchísimas
panelists we have for
gracias,
today's meeting. Thank you.
Florencia.
Thank you,
Ahora en lo que
Florencia,
sigue
very
vamos
much.
a, vamos a tener
Now,
reflexiones
we're
sobre los
going
desafíos de poner en
to have
práctica este
reflections on the
análisis
challenges for
al
ethical
hacer la
review
revisión ética de los
of
protocolos de
research involving
investigación,
people in situation of
considerando distintos
vulnerability,
entornos de
taking
investigación,
into account the
distintas
different
experiencias y distintas
research
poblaciones que
context
pueden estar en
experiences
situaciones de
and certain of the
vulnerabilidad.
population that may
Antes de
be
dar
vulnerable.
paso a estas
Now,
cuatro
before
reflexiones de distintas
giving the
experiencias que vamos a
floor
tener,
to the four
yo quiero
speakers that will
resaltar la
refer to this, I would
importancia
like to
del
highlight
abordaje que
the
propone
importance
Florencia, cambiando
of
la
the
manera
approach
como
Florencia
concebimos la ética de la
suggests
investigación.
because it changes the way
Siempre
in which
resaltamos
we think about
en estos
research
seminarios la
ethics.
importancia
During
de
our
la
webinars, we
granularidad del
always
análisis
highlight
ético y de
how
lo poco que nos
important it
sirven
is
las
to
presuntas
go
soluciones
down to the
unitarias
detail
a la
and
ética.
that we need
Históricamente,
to
la
try to step
visión era,
away
como bien
from
decía
more
Florencia, más
static
rígida,
visions.
que con
Florencia
la
just said it
percepción
used to
de
be, the
que
perception used to
lo
be
más
more rigid,
ético
and the
significaba mayor
perception was
protección y la
that
manera de lograr una mayor
what was
protección era haciendo esto
more
etiquetado de
ethical and
poblaciones concretas.
the way to provide
Sin
more
embargo, creo
protection
que
was to
todos
label
tenemos la claridad
entire
ya que proteger no
sections
es
of the
excluir
population.
categóricamente.
But we all know
Excluir de la
that protecting
investigación
does
supone
not mean
excluir de la
excluding.
posibilidad de
Excluding from
beneficiarse de la
research
ciencia.
means
Y
excluding people
en,
from the possibility of
en otra
benefiting
pauta
from
que
science.
Florencia no ha
And in another
mencionado,
guideline
la
that
3, hay,
Florencia did not mention, which is
un
guideline
contenido muy
3,
importante
there is
relacionado al
a lot of
impacto
content
que
that has
ella ha
to do
explicado, que
with
es
the
que
impact of what she
estas
just
exclusiones
explained.
categóricas de
And that is
poblaciones
that
completas que resultan de
categorically
entender a la
tagging
vulnerabilidad
entire
como un
sections
etiquetado
of
de
the
grupos
population
es
as
una
vulnerable
injusticia que tenemos el
is
deber moral de corregir.
injustice. and we have the moral duty to undo that injustice. So we need to make sure that clinical trials benefit not only certain sections of the population, but all of them, and to ensure the responsible and ethical inclusion of all sectors of the population in clinical trials is key that we try to discuss often. Well, now it's an honor for me to invite Dr. Gloria Palma from Colombia. She's the chair at the Institutional Committee on Human Research Ethics, CDEIM, in Cali, Colombia, and she has a long history of working on research ethics. And thank you so much, Gloria, for joining us today.
Good morning, everyone. It is truly an honor to be here today. I was so pleased to receive Carla's invitation, and I know that I'm going to follow right now Dr. Florencia Luna, and that is such an honor. I wear two hats. The first is that since 1991 or perhaps before, I have been working with the Ethics Committee, first as a secretary and then as a member, and I currently chair the ethics community on behalf of the research centers, and I'm a WHO collaborator. That is one hat. The other thing is that I really was trained as a researcher in the area of tropical diseases, and I am a physician and parasitologist, and I have worked on research looking at the relationship between infectious organisms and human beings, that is to say, the immune response. In other words, I had not worked so much on clinical trials. So I have the view from both sides, the view of the researcher and also the view of a member of an ethics committee that evaluates the research project. When I began to work as a researcher, and I'm ashamed to acknowledge this, but the first experience I had was in the 1980s. And they did not go through ethics committees because ethics committees did not exist in Colombia. And the rules creating ethics committees to ethics review committees for research on human beings did not appear until 1993. But before that, I worked on filariasis, and everything that was published on this, none of that went through ethics committees. And I was working in parts of Colombia with indigenous communities. So, in my view, after all of this time, I had to say, what did we really do as reserschers? How could we not respect those people? Well, that's published and it's still referenced in the literature. And then later on, in 1993 in Colombia, a resolution came out. It's a resolution, it's not a law. And in Colombia, before that, we did not talk about vulnerable populations, and the concept of vulnerability did not really appear until the 21st century. We talked about subordinate groups. And that's what I think many people understood. Subordinate groups, there may be students or other people who are working in hospitals, patients, incarcerated persons. So we had to bear all of this in mind. Pregnant women and children also, they were also subordinate subjects. So the easiest thing was to either exclude them, or one of the things that this resolution says, because we haven't been able to change it yet, is that in the ethics committees that are going to evaluate the project, they had to look at, there had to be someone from those communities in the committee in order to analyze the project. And what would that a member of the community do? It's not stipulated. And that's when the idea came out that a member of the community should be represented in the ethics committee. And in Colombia, that became the rule. In fact, the resolution itself just says that it's for a certain type of research. However, nowadays, all of the ethics committees in Colombia do have a member of that community or of the community. So I've been going between those two roles as a researcher and as a member of an ethics review committee. So the first memory that I have is thinking, what is the role of that community member? And who are those community members? At some institutions, in mine, for example, these are always professionals, and either they know about research or they conducted research and are currently, well, they've retired from that. They don't really represent a community, but that's who they are. And we could say that on the committee, it's mandatory to have a member of the community in order to have a quorum. So we always have to have the 3 or 4 of those people in the committee. And other committees that I'm familiar with, the function in Cali, have 1 or 2 community members, and their role is simply to read the informed consent form, and if they're member of the community says it's okay, then the community approves that informed consent form. In my view, that gives me a lot of anxiety. I'm worried about this, and I'm also worried about the other things that I did previously as a researcher. And it is precisely for this reason that we have to go back to the concept of vulnerability, and we see that it's been applied to simplistically. And one easy way to apply it is by excluding people and without analyzing the circumstances. And as Dr. Florencia very well stated it, many of these circumstances or layers of vulnerability are things that neither the researchers nor the members of the ethics committee can change. However, I think that if we do a very careful analysis of their circumstances, it might be possible to come to an intermediate point in which you can ensure protection that those people need in order to participate in a research project, and also make sure that they are participating because they truly understand that it's a research project. Because this brings me to the next problem that we have when we talk about vulnerability, and that is the issue of informed consent. It's very easy to say that the process of informed consent has to be done in a way in which the person understands perfectly well what is being done. However, the problem is, and this is what gives me anxiety, I have worked with communities on the Pacific coast of Colombia. These are very impoverished communities. They're at a very low socioeconomic level. The health services are quite scant. And I come to work on the immune response on T lymphocytes for leishmaniasis. That's too esoteric for them. The idea behind all of this is that we're trying to find a good type of treatment, diagnosis, and interventions. But how can I explain all of this to those individuals, the subjects of my study? Do they truly understand that the samples that I'm taking, what they're being used for? Many of these studies are done on immunology, are not going to have a direct impact on the population that we're working with, because we are collecting information which will serve to construct solutions in the medium or long term. In other words, those individuals are truly participating out of altruism and not because they will directly benefit from that research. Now, obviously, we explained to them that this research, most likely, if something positive will come out of it, and it is possible that the approach that we have in terms of certain cells might not come out there, and it might take years for us to conclude all of the experiments and to look at it in the laboratory. So they may not, the community may not benefit from it at all. So that is perhaps one of the things that really concerned me about the kind of research I was involved in. How can I explain to people that these are studies that are trying to get that kind of information, and perhaps that information will be usul to them and their community, because the disease is a vector transmitted disease and it's going to keep circulating, and we're going to work with all of the vectors, and we're trying to have early diagnosis, and perhaps if we do immunological studies we can have early diagnosis, find the markers. So there are all kinds of potential interventions, but people who barely know how to read and write, and some of them do not speak Spanish because they are indigenous communities. How can I explain all of this to them? This is one of the things that I've not been able to reconcile. Carla says, yes, thank you. We would like to hear more from you, but time has run out. So I just wanted to say this is the problem. And one of the problems that I kick back to the ethics committee, and the ethics committees really do not know how to handle it. Thank you very much. And I'm sorry that I went over time. Thank you very much, says Carla. Thank you, Gloria. I fully agree with you in that it is much easier to just avoid including those populations than it is to do this very careful analysis to make sure that the research will benefit as many populations as possible. I would now like to invite Dr. Bernardo Aguilera Drese from Chile to speak. Dr. Drese is a member of the School of Medicine at the University of San Sebastian, where he is also an assistant professor, and he has prepared a presentation with Claudia Metz, who is the executive secretary of the committee, and they're going to share this presentation. Thank you very much for being with us, Bernardo. Thank you, Carla. I'm going to present to you a work that I prepared with my colleague Claudia Metz, who is right next to me, and I'm going to share our PowerPoint for today. Both of us are members of the Scientific Ethics Committee, as we call it here in Chile. And we were very interested in looking at how researchers are addressing the issue of vulnerability with research participants. This analysis comes out not so much a research project, but rather a preliminary assessment of how our committee is doing and how we look at issues of vulnerability. What we did was to review all of the projects that we received last year. We identified the studied population for each of those projects. For the purposes of this research, we limited our search and left out in which we were less likely to find vulnerable persons. So at our university, we determined that these were rather healthy adults students and instructors. There may be some vulnerability, but in order to limit our review, we decided to exclude those ones and to rather focus on studies that focus on groups of people in which we considered it to be important to seek and determine conditions of vulnerability. So this is where we needed to be cognizant of vulnerability issues. So it was 74 people in which we were looking at people who are sick or have disabilities, caregivers, older adults, minors, and women. And then we looked at the ethical analysis section for all of these projects, what was originally submitted. And we identified 21 of these that mentioned vulnerability. Only 28% of all of the projects mentioned, or at least mentioned, the concept of vulnerability. Then we extracted the passages that mention vulnerability in those 21 projects, and we analyzed the reason that they mentioned vulnerability and whether special protection measures were adopted for the vulnerable population. It is important to bear in mind that our committee puts instructions on the website for the ethical analysis for researchers and explicitly mentions that if we are dealing with a vulnerable population, one must specify the corresponding protective measures. So we know that that would encourage our researchers to bear this in mind. Now, what did we find? We found that the populations studied in the 21 projects that we reviewed included people who are sick, minors, caregivers, older adults, and women. Now, one point that this is projects, or rather, this is just for the projects that mention vulnerability. So those are the populations that were indicated in the projects that indicated vulnerability. There may be more than one cause of vulnerability per project. And in 4 of the projects, they mentioned vulnerability, but this was not applied. So that was rather common. In other words, they would say that this study is going to seek factors of vulnerability, or the vulnerability of the participants will be borne in mind. In other words, it seemed like that was more of a cosmetic approach, but it did not really have an impact in the project. For 3 of the projects, the concept of vulnerability is mentioned to justify the fair selection of participants. So in 3 of these, they mentioned that certain groups, because they are particularly vulnerable, were not included in the study. So it was to demonstrate that the process of selecting participants was fair because certain groups within the population studied had very serious illness or had difficulty understanding or other factors. And they also mentioned vulnerability to justify the social value of the study, but it was on the other way. They talked about the vulnerability of a group in order, which was used in favor of including them in the study. That was true for older adults. So 4 projects mentioned vulnerability to justify the social value of the study. In other words, they mentioned vulnerability to highlight that they were studying a group of people who had been neglected, or we do not know very much about what's happening with them. And so that indicated the social value of this study because we were going to be looking at this vulnerable group. Then more than half of the projects that we reviewed mentioned vulnerability for what we really expected, which was that this was why they had to take protective measures. So this was not all the projects, as you could see. Many projects mentioned vulnerability, but it did not have any impact in terms of offering protection. Now, in terms of the groups that mentioned vulnerability that were taking measures to protect the vulnerable population, two of them curiously talked about the vulnerability of the participants. However, they did not specify what protection was going to be taken for them. So it would seem that vulnerability was really just decoration for them. And five of them, they did specify protections, but we saw that many of the protections that they specified were really quite standard. So they refer to the consent process, but it was really what you would expect for adults. Confidentiality, to care for the well-being of the participants, which is standard in any research project. So we do not see that any additional protection was provided in light of their vulnerabilities. Then in 6 projects, we did find special protection, what you would expect if you identify a context of vulnerability. So for 2 of them, it had to do with continued and specialized care by a health professional. So there were anesthesiologists who worked with older adults, and then we understood that they needed to have professionals continuously assessing their well-being, and also people who had a severe dermatological disorder. So there was a dermatologist who was going to closely monitoring the health of the participants, and that's a specific form of protection. In 3 of the projects, the process of consent for older people was particularly careful. So there were far more detail and much more care was taken to take measures to ensure that the participants would understand. We took more time with it. And for one project, the study materials were adapted to address the characteristics of the participants. And this was for children, and the study made a specific effort with them. So our conclusions in this a small review that we did, we saw that the concept of vulnerability in practice is often not mentioned systematically when potentially vulnerable populations are studied. So even once you select groups that should have looked at potential vulnerability, persons with disability, diseases, or older adults, they did not really properly apply the concept. But when they did mention, often they did not reflect on the context of the vulnerability of the participants. So it was almost like just going through a checklist to mention it, but they did not reflect on the impact of this. And this did not lead to specific safeguards. Just as what Professor Luna said, you have to go from just mentioning the vulnerability to putting it into practice. So we recommend that we have more education for researchers and motivate them to use the concept of vulnerability in a more significant way. Thank you very much. Thank you, Bernardo. I think that your presentation is an excellent transition from Gloria Palma's reflection and her role from the ethics committee, and to how researchers are thinking of the concept of vulnerability. I think just as with other concepts in ethics, we've always seen what you call the decorative application of these standards. Now, I am to welcome Dr. Ana Palmero, who is going to share with us reflections on the challenges for ethical review of research involving adolescents. Ana is a consultant to the Secretariat of the Ethics Review Committee of the WHO and the Unit of Ethics and Global Health Governance. Thank you, Ana. You have the floor. Thank you, Carla. Thank you for inviting me. And I also thank you, Florencia, for your presentation. Today, I wanted to share some reflections on my role as a member of the committee. I have several years of experience in various ethics committees, both here in Argentina and also internationally. And I'd like to focus on how you apply the concept of vulnerability in a specific group, in this case, adolescents. When we talk about minors, as Florencia was saying, you automatically label them as vulnerable. And this is under the concept of vulnerable, that people are challenged in defending their own interests. And so they may be subject to greater harm in a research project. But in the case of adolescents, they are a unique group, first because they're transitioning from childhood to adulthood. Also, there are some fundamental rights that they have, particularly related to respect for their progressive autonomy and how their decision-making capacity is evolving according to their maturity, as happens with everyone, and also in terms of needing more respect for their privacy. So generally, when we talk about minors and how we protect them, what people first think of is the presence of mother, father, and or the guardians of the minor. But for adolescents, if we think of the role that we have as ethics committee in assessing these research projects, we have to identify those layers of vulnerability that Florencia talked about. When we look at adolescents, the situation is different. We have to think of defending or identifying the things or situations that will require extra care on the part of the researchers in order to protect the adolescents so that they can defend their own interests and also allow them to exercise their progressive autonomy. Clearly, it's not the same to work with an 7 or 8-year-old child as it is to work with a 17 or 18-year-old teenager who is very close to what is legally considered an adult. And often there's a specific age cutoff. If you're a week shy of your 18th birthday, you can't make a decision. And once you're 18, you can. But that is not necessarily an ethical approach. So we need to assess the studies in which adolescents participate. And we must think of the safeguards that go beyond the accompaniment that a mother or father might provide, because in all countries that is generally a legal obligation, but there are circumstances in these studies that give rise to these situations in which the teenagers need to make their own decisions, for example, reproductive and sexual health, and also prevention of HIV. In these cases, often the teenagers that participate beyond their specific needs, we might find other layers of vulnerability that have to do with the social sector that they belong to, and also the possibility of having a mother or father present that support them in their own autonomous decision making. And maybe they aren't there because they have different interests for religious or cultural reasons. So, in this regard, we need to think, we need to reflect on that labeling that we tend to do with children under legal age, and that we always want to have the parent or guardian present, but rather bear in mind the context and other measures that can be taken so to defend the interests of these adolescents, and above all, respecting their ability to make their own decisions in health and to also respect their privacy. For example, in situations in which they are invited to participate in this type of study on sexual and reproductive health, often starting at age 16, we tend to have a cutoff in which adolescents can make their own decisions on certain interventions. The same is true, for example, here in Argentina, the cutoff is at age 13. Beyond that age, it's considered if there's no serious risk to their safety and health, they can take their own decisions without needing parental consent. But what does this mean? This means that as an ethics committee, it doesn't mean that we say that they're adolescents that are closer to adulthood and they can make all their own decisions. No, this requires the committee and researchers, as we approach these projects, to think to what degree can we have respectful and responsible inclusion of this sector. For example, adolescents generally don't want their parents to be involved in these processes for whatever reason, either because their parents aren't available or because they have conflicting interests. So there may be other measures that can be taken or considered in order to build trust and include youth in these processes and in the study. And we might consider giving them support from special teams that work with adolescents. So we need to think of different kinds of measures that can allow adolescents to be able to exercise their rights, make their own decisions, while we respect their autonomy, but also protect their privacy. So I don't want to go over time, but I'll just leave it there. And I'm ready to continue the discussion during the Q&A session. Thank you, Carla.
Ana, creo que
Thank you, Anna, very much. I believe it's been great to go from the challenge that Bernardo talked about, which is the need to have concrete safeguards, to see how it's done in practice, specifically when we talk about adolescents who tend to be more prone to being hurt from being part of a research project because they are not in a position to stand up for their own interests. But of course, this is something where bioethics has made a lot of progress on. Now, I would like to invite Carla Sarracedo from the Bioethics program at PAHO to share some reflections on a similar case, which is challenges for ethical review of research involving people with mental disabilities. Go ahead. Thank you, Carla, for the introduction. And I'm going to now share my screen. I know it's not right, but I believe you can see it now, correct?
Bien, gracias. Entonces, yo muy rápidamente
Perfect.
voy a ir por
So now,
algunos desafíos
very quickly, I'm going
que
to talk
existen
about
para la
some of
inclusión de
the
personas con
challenges
discapacidad
for the
mental en la
inclusion of people with
investigación.
mental disabilities in
Sabemos que
research.
existe este deber ético de realizar
We know that there is
investigaciones
the
con
ethical
personas con
duty to
discapacidad mental.
do
Las personas
research with
con
persons with
discapacidad
mental
mental
disabilities,
merecen tener
because they deserve to get answers from science for their conditions, to have better health outcomes. And any research that we do with persons with mental disabilities, we have to stick by international ethics standards. When we talk about participants with mental disability, in this presentation, we mean those who have mental and neurological disorders. And like we know, these disorders may impact on people's decision-making ability. For that, when we do research with these types of persons with mental disability, we need to ensure that we get all the appropriate informed consent.
La investigación en sí, antes quería mencionar esta convención sobre los derechos de las
Before
personas con
talking about that, I
discapacidad,
would like to
que es un
talk about the
tratado de
Convention
derechos
on the Rights of
humanos
the People
de
with
la ONU
Disabilities,
que está
which is
vigente desde
an
2008
UN
y que ha marcado un hito en el
convention
reconocimiento de los derechos
since
de las
2008,
personas
and it was a
con
landmark
discapacidad. Y de
document
hecho, representa
in
un
terms of
cambio de
peoples with
paradigma
disabilities. And
porque
it was a
reconoce a las
paradigm
personas con
shift
discapacidad en
because
situaciones
it
en situación de igualdad
recognizes
frente a las personas
that
que no tienen
people
ninguna
with mental
discapacidad. Y
disabilities
creo que
have this exact
ha
same
cambiado
rights as the
también
people that do
este
not have
rótulo,
such
como mencionaba
disabilities.
Florencia al inicio,
And
de
like Florencia said at the
personas
beginning,
con
it changed
discapacidad
from saying person
mental es
with
igual a
mental,
vulnerable, ¿no? Entonces,
that,
y es muy
the idea
clara
used to be
el
that
propósito
people
de
with mental
que
disabilities
no toda
equal
persona con discapacidad
vulnerable
mental es
people.
vulnerable
So
por
basically, this says
este
that
nuevo
not
hecho, ¿no?
all people
Entonces,
with mental
hay dos
disabilities
artículos que
are
nos interesan
vulnerable
para la
just
investigación
because of
de
that
esa convención.
disability. Now, there's
El
a few
primero es
articles
este artículo
from that
15,
convention. The first
que
one is Article
en el subtítulo de
15.
protección contra la tortura y otros tratos o penas
It's
crueles,
under
inhumanas o
the
degradantes,
headline
hace
of
mención a la investigación en cierta
protection
forma y dice
against
que
torture
nadie puede
and
ser sometido
cruel,
a
inhumane,
experimentos
or
médicos
degrading
o científicos
treatment, and it
sin
says
su
that no
libre
person
consentimiento.
may be
Y por eso
subjected to
es tan
torture
importante
or medical treatment
ver
without
qué más
their
nos dice este
consent.
tratado
And
sobre el
so
consentimiento.
we have to
Antes de pasar a
think
la otra,
about
quiero decir
what
que esta
we know about
convención ha sido
consent.
ratificada por
Before
19
moving on
países
to
de la
that,
región
I have to
y
say
de
that this
estos 19
convention has
países,
been
8
ratified
han
by 19
modificado sus
countries
normas
in the
generales
region, out of which
sobre el
8
consentimiento y la
modify
capacidad
their
de las personas con
regulation in terms
discapacidad
of the
mental,
consent
aunque
from
casi
people
ninguno lo ha
with
hecho para la
mental
investigación en concreto.
disabilities, although
Otro
nobody
artículo
did
que
so in the
nos
in the
importa
specific
ver
context
es
of
este artículo 12, el inciso 2, que
research.
menciona que las
We
personas con
also
discapacidad tienen capacidad
have
jurídica
Article
en igualdad
12,
de condiciones con las
subparagraph 2, that
demás en
says
todos los
that
aspectos de la
all
vida.
persons with disabilities have the
Este artículo ha
same
sido
legal
interpretado en el 2014 por el
capacity as
comité
everybody
de la
else.
convención, que
This
es
article
digamos, el
was
organismo que
interpreted in
supervisa,
2014
interpreta
by the body that
al tratado
supervises and
y ha dicho que
interprets the
tres cosas
convention,
importantes. La primera
and
es
said
que
two
todas las
important
personas con
things. The
discapacidad
first
tienen
one
capacidad
is that all
jurídica
persons with
universal
disabilities have
siempre.
universal
Esto quiere decir que
legal
toda persona con
ability. That is
discapacidad,
to say that
cualquiera
any
sea su
person with
condición mental
disability,
y
regardless
neurológica,
of their mental
tiene
or
capacidad
neurological
universal
capabilities,
para tomar
is
decisiones.
universally able to make
Eh,
decisions.
Esto ha llevado además a decir que
So
todos estos
this
regímenes que existen
in
en los
turn led to
diversos
think that all
países de
these
representantes
regimes
de
that
legal
exist in
o
different
representantes,
countries,
digamos, que
that, for example, to
sustituyen
have a
la
legal
voluntad de las
representative or
personas con
somebody
discapacidad,
that
vulneran derechos
gives
y
consent
deben
on behalf of
prohibirse
persons
y
with
que más bien
disabilities
se debe
are
instaurar
violate
un
rights,
sistema de
they must
apoyos y
be
salvaguardias
banned, and
para
rather
que
we need
estas
to have a
personas con
system with
discapacidad
support and
tomen sus
safeguards so that
decisiones.
these
Y
people
además
with
ha
disabilities can make
mencionado
their
que
own
todas las
decisions.
evaluaciones que
It also
hacemos de la
mentioned that
capacidad
all of the
para tomar
assessment
decisiones de las
that
personas son
we
siempre
make in terms
discriminatorias.
of
¿Qué
decision-making
nos dice, por otro
abilities are
lado, las
discriminatory
pautaciones, que
in
como
nature?
sabemos son los
The
estándares
science guidelines that
internacionales?
are, are the
Sabemos que
standard
para poder dar un
uh,
consentimiento
at the
informado
international level.
válido, es
We know that
necesario
in order to give
ser
free
competente,
informed
¿no? Para poder tomar
consent, we need
decisiones
to
que se
be
traduce
competent
en comprender
in
adecuadamente la
making decisions,
información,
which has
sopesar
to do
riesgos y
with
beneficios
properly
y bueno,
understanding
decidir de manera
information, weighing
voluntaria
in
sobre la base de
the
esto, ¿no?
advantages and disadvantages, and then
Entonces,
to
cuando una persona
voluntarily
es
make a
invitada a
decision based
participar
on
en un
that.
estudio, se
So
presume
whenever a
siempre que
person
es
is invited
competente
to be part of a
para
research project, we
tomar
assume that
sus
person is
decisiones.
competent to
Pero
make
en
their own
caso no pueda
decisions.
tomar sus
But
decisiones, lo que sí
if that person is
menciona
not
es
able
que
to make their own decisions,
puede
what
hacerlo
science
un representante
says
legal
is
autoriza la
that that
participación
person
de esta persona
can do so
y que
through a
además esta
legal
autorización
representative.
debería tomar en
And
cuenta
this
las preferencias y
authorization
valores,
should
¿no?
take into
Si es
account
que
the
estas
person's
preferencias y
preferences
valores
and
existieran y se conocieran.
values
Y
if
además que hay que
they
buscar el
exist
asentimiento de la
and are
persona
known.
en la
And we
medida
also need to seek
de la
consent
medida de lo
from
posible.
the person to the extent possible.
Entonces, al igual que muchos ordenamientos
So
jurídicos y
just
normas
like
legales, las
other
pautas
legal
éticas
systems,
internacionales también mencionan que
international
si un
ethics
potencial
guidelines
participante
also
tiene
say
una
that if a
disminución
potential
grave o una
participant has
disminución
a
de su
severe
capacidad para decidir, se puede
uh,
delegar esta
has
decisión
their
de
decision-making
participar
ability
en una
severely
investigación en un
diminished,
representante que
the
puede
decision to be part of a
actuar
research
como un sustituto.
study
El problema
can be
es que
made
sí
by
ofrece un
a
enfoque funcional
representative.
a la
The
capacidad
problem is that
y
science has a
permite poder
functional
sustituir la voluntad de las
definition
personas
for
y la Convención sobre los Derechos de
capabilities,
las Personas con
and the
Discapacidad
Convention
rechaza
on the Rights of
tajantemente este
Persons
enfoque
with
funcional y
Disabilities
prohíbe sustituir la voluntad
rejects
de las
this
personas.
functional
Esto
approach and
genera
bans
varias
substitution of
consecuencias
people's
preocupantes.
will.
Primero es que
This
bajo
has
el
some
supuesto de capacidad jurídica universal se van a poder incluir,
worrying
digamos,
conclusions. For
muchas
example,
personas con
under
discapacidad
this
mental
universal
y que
legal
tengan una
concept,
disminución
we
grave de
may
su
include
capacidad
a
para
lot of
tomar
persons
decisiones,
with disabilities who
sin
are
contar
severely
con procesos de
unable to
consentimiento
make
informado,
decisions without
de procesos de consentimientos
having
informados válidos, es decir, expone
valid informed
indebidamente a las
consent
personas,
processes. That is to say, it
pero por otro lado,
exposes
frente a esta
people
prohibición de tener estos
in those
representantes, que
conditions
además es
unduly.
acogida por muchos
But because of
ordenamientos y
this
por muchas
ban
legislaciones de la
on having a
investigación,
representative, which is
lo que
also
hacemos
reflected in
es,
other
mejor no
legal
los
systems,
incluimos en la
what
investigación
we
porque
say
en
is
la
like
práctica
it's
no
better not to
sabemos
include
muy
them
bien
in our
cómo
research study
debemos
because in
realizar
practice we
estos procesos de
don't know
consentimiento
how
informado,
to
¿no?
go
Entonces, nos
about
vamos de la exclusión,
getting their
de la
informed consent.
sobreprotección a
So we go from
exponerlos
exclusion to
indebidamente y a
overprotection
dejar que
to undue
participen
exposure
de cualquier
to
investigación, tal vez sin haber tenido
prevent
los
them from
resguardos
being
adecuados.
part or to being
El año
accepted in any
pasado
research study
vimos
without
con
having
Bernardo,
the
que
right
también
safeguards
estuvo en
in
ese
place.
panel, y con Renato
Last year,
Constantino,
Bernardo, Renato, and
este artículo que, digamos, profundiza
I
más
co-authored this
en eso
article
en este
that
problema que he tratado de explicar muy rápidamente. Y
addresses
creo
in more
que,
detail this
en
issue that
resumen,
I've
proponemos tres cosas
touched upon.
para
And in
poder
summary, we're
conciliar, ¿no?
suggesting three
Es una
things.
posición intermedia
So this is kind of like a
entre estos estándares
compromise
éticos internacionales
between the international
y
ethics
la
standards
posición de
and the
la
position
Convención.
by
En primer
this
lugar, rechazamos esta
convention.
capacidad
And so,
jurídica
first of
universal.
all,
La
we
capacidad
reject this
jurídica
universal legal
universal para,
capacity or
digamos,
ability,
es un
rather,
concepto implausible.
that
No es
is not
posible,
possible in
debemos reconocer que hay
practice.
personas que no
We
pueden
have to
tomar
acknowledge that
decisiones por sí
certain
mismas
people cannot
y que
make
por ello es
decisions
necesario
for
conservar incluso
themselves, and
este criterio
therefore we
funcional de la
need to
capacidad
have
que
this
nos hace poder
definition
evaluar,
that enables us
digamos,
to
o poder determinar si las funciones
determine
cognitivas de las personas están
whether
afectadas y a
the
qué
person's
medida. Y esto es
cognitive
importantísimo, sobre
functions
todo
are
para personas
impacted,
con
and if so,
discapacidad,
to what
porque eso
extent.
nos va a
This is
ayudar
key for persons
a
with disabilities
realmente
because it helps
determinar
us
cuáles son los apoyos y salvaguardias
determine what
que
kind of support
requieren estas
and
personas para
safeguards these people
realmente
need,
hacer todo lo posible para que puedan decidir si quieren
and that
participar
way we
o
can
no en una
ensure
investigación.
that we
Estos
get their
apoyos además tienen
consent
que ser
on whether or not they
adecuados
want to be
caso por
part of a
caso.
research
Es muy
study.
importante
This has to
evaluar el
be done on a case
contexto
by case
en
basis. We
atención
need
a las
to
capacidades que se
assess
encuentran comprometidas.
context and see what
Y
kind of
además es muy importante tener en cuenta que
abilities
esos
are
apoyos y
compromised. And
salvaguardias
we
pueden
also need to
variar
take into
en
account
cuanto
that
a
this
tipo
support
o
and
intensidad,
safeguards
y
can
que estos además se
vary
deberían
in
brindar de
type
manera
and
progresiva. Y entre los apoyos y
intensity, and they should also
salvaguardias
be
que
provided
mencionamos,
in a
hay
progressive way.
uno
And as
que
part of the support and
sugerimos que es el apoyo con
safeguards
poder
that
de
we provide,
representación que
we
actúa de acuerdo a la
mention
voluntad y
the
preferencias del
proxy,
potencial participante.
which
En
has to
caso que esta
do with
evidencia no
the
existe
potential
o no podamos
participants'
conocer
preferences.
esa
Now,
voluntad y
if
estas
we are
preferencias,
unable to
no
know
va a ser
about the
posible realizar una
person's preference,
investigación
we
de
will
manera
not be
consistente con
able
lo que dice la Convención,
to
pero eso no
perform our
necesariamente
research
significa
consistent
que
with what the
sea esto
convention says,
no
but
sea
this
éticamente
does not
aceptable, porque, por
necessarily
ejemplo,
mean that
si una
that's
investigación va a
not
representar la
ethically
mejor
acceptable,
alternativa
because
para una persona,
if
para un
a
potencial
research
participante,
study is
es
going to
éticamente
be the best
aceptable su
alternative for a
inclusión, a
given
pesar de que
participant, it
esto
is
sea parte de la
ethically
Convención. Y con eso
acceptable to
terminé
include
en mis 10 minutos.
this
Muchas gracias por
participant.
la presentación y tal
And
vez en
that
la discusión
concludes
podemos
my
entrar más a
10-minute
detalle.
presentation, and
Gracias.
maybe during the discussion we can get into further
Muchísimas
detail in some
gracias
of these
a
aspects.
Sara. Creo
Thank
que ha
you so
sido,
much, Sarah.
toda una trayectoria desde lo más
So we've
conceptual a
come
las
a long ways
experiencias y
from
las
the most
salvaguardas
concept-based to
más
the experience
concretas en casos
and the more
específicos,
specific
considerando incluso algunos
safeguards.
desafíos legales.
And
Quiero
also you
invitar
mentioned
a
some legal challenges.
Florencia,
Now I would like to
y a
invite
todos los demás panelistas, a
Florencia
Gloria,
and the
Bernardo,
rest of our
Ana,
panelists,
a
Gloria,
volver a la
Bernardo,
sesión
Ana,
para
to come
aprender sus
back to
cámaras
the session, turn
y
your cameras on
retornar para tener una
so
conversación.
we
Quiero
can
iniciar,
have our
Florencia,
discussion.
no te
No
vemos.
me deja prender la cámara.
Florencia,
Estoy acá, pero no puedo
I cannot turn my
bien
camera on.
negarlo.
I don't
Ahí
know, it's
estoy.
like,
Ahí
oh, there it
anda.
is.
Yo quiero iniciar dándole la palabra
I
a
would like to begin
Florencia
by
y
giving the
pidiendo
floor to
que nos comparta
Florencia
sus reflexiones
and
luego de haber
asking her
escuchado
to,
todos estos,
after having heard
estas capas, me viene
all
la
of
palabra en
these
la cabeza,
layers, that's the only thing the only word I can think of
implementación, de desafíos,
implementation
de
and
complejidad,
challenges,
de lo que implica
complexities, etc.,
usar el
around
concepto de vulnerabilidad en la
the
práctica de un
concept
registro
of
víctima en la
vulnerability
revisión de la
in
investigación.
practice
Adelante,
when
Florencia.
we do research
Bueno, en
review.
primer
Go ahead,
lugar,
Florencia.
me resultó
Well,
muy interesante cuando
first of all, it was
Bernardo
very interesting to me
decía
when
que en realidad
Bernardo
hablaban de vulnerabilidad,
was
pero que
saying
no
that they talked
especificaban
about
protecciones y
vulnerability,
que
but they didn't
porque
specify any types of
justamente lo que se
protections
plantea como crítica,
because
Carol
the
Levine y sus
criticism
colegas, un
that
poco lo que
Carol
dicen
Levine
es,
and et
todos son
al
vulnerables, pero
say
después
is
no
that
dicen qué
everybody's
hacemos,
vulnerable, but then nobody
ni
tells us
sirve
what to
demasiado
do
ese
about it.
concepto,
So
como
that
una
concept is not
superpoblación
that
de
useful. It's like a
poblaciones vulnerables que
super
no
group
especifican
of
nada. Y me
vulnerable
parece
populations that at the end of the
eso es
day
parte del
does
desafío.
nothing.
Yo creo,
And I believe
a
that's
mí
part
me
of the
parece
challenge we have.
interesante,
I
bueno,
find
acá
it
por lo
interesting
que también recién
to
nos planteaba Sara,
highlight what
de buscar
Sarah
una vía
just mentioned
intermedia,
in terms
¿no?
of finding a
Porque me
compromise.
parece que muchas veces no solo en los discursos políticos
Because
son de blanco o
oftentimes
negro,
not
sino
only
también en la
political rhetoric
bioética es
is black
como
or
que
white, but
caemos
also
en
in
o no se puede
bioethics,
hacer nada o se puede hacer
we
cualquier
say
cosa.
we
Y no
either
es
can't do
así.
anything
Tiene
or
que
we can
haber,
do any we can
en eso
do
sé que
anything or we can
coincidimos
do
creo que
everything. And
todos,
that can't be.
es
I believe we all
un
agree
análisis crítico, ¿no?
that we
Que
need
tenemos que
to do
poder
some sort of
deliberar, analizar la
critical
situación en particular.
analysis
Así que,
to
digamos, a mí me parece
look at
que
each
todas
individual's
estas propuestas
case.
también, lo
So I believe
que,
that
lo que señalaba
these
eh,
proposals,
Gloria,
for
también lo que
example, what Gloria
señalaba
said
Ana, ¿no?
and Anna
Respecto
said
de los adolescentes son
regarding
puntos a tener en cuenta,
adolescents
¿no?
are
Cómo
definitely
trabajamos
aspects that
y
we
de
need
qué
to take into
manera
account
buscamos poder
and that
integrarlos
dictate how we work
y
and
tomar
how we can
conciencia que
include
muchas
them.
veces eso,
And
que
also
cuando
to be aware of the
protegemos
fact that sometimes
sobremanera, cuando
when
tenemos esa
we
sobreprotección, en realidad
overprotect,
terminamos desprotegiendo,
actually
porque
we
esto,
are
por
not
ejemplo, se
protecting
ve
at
muy
all.
claramente con el
And
caso
this
de
is
las
very
mujeres
clearly
embarazadas,
seen
¿no? O
among
sea, las
pregnant
mujeres
women.
embarazadas se las
Pregnant women
sobreprotege
are
de tal manera que, o
overprotected
sea,
to an
quedaste
extent
embarazada rogando,
that you're
enfermarte
pregnant
durante
and you
los
have to
9 meses,
pray you don't get
porque
sick
no hay
over the next
prácticamente medicación que
9 months
se haya
because
probado,
practically
o si
there's
estás
no
enferma, roga
universally
no
approved
embarazarte,
medication.
¿no? Porque
Or if you're sick,
eh,
pray that you
entonces
don't get
me
pregnant.
parece que ese es el quid de la cuestión y me
So
parece
I
súper
believe that
valiosas
is the
las
crux of
búsquedas
the
como
issue.
intermedias, ¿no? Donde uno
And
trata
I
de
think it's
ver,
very
y me
important to
parece que esto es
find
parte de
these
lo que tenemos que seguir
compromised
trabajando.
views.
Creo que
And
todavía nos
that
queda
shows that we
para
still
ir
have a lot of
viendo
work
de qué
to do.
manera,
We need
digamos,
to keep working
conciliar
to see how
como
we can
una protección, un concepto de vulnerabilidad que pueda dar
get
cuenta de
to a
mayor como
vulnerability
sutileza, ¿no?
concept
Y que nos
that
permita
will
proteger
be more like
adecuadamente
nuanced and that would
y
enable us
a
to
la vez
appropriately
hacer
protect,
investigación cuando
but
es
at the same
debido, cuando
time
es éticamente
including our
aceptable,
research
¿no?
when it is
Y eso es
ethically
parte de lo que tenemos, no hay
acceptable.
como recetas.
And
Ese es
for
el
that, we
problema,
don't
no
have
hay
a
recetas.
recipe or a formula,
O
and that's the
medicinas, yo
problem.
creo que también a veces pasa que
The same
como
happens in
muchas
medicine.
personas de la medicina están acostumbradas al
A lot of
recetario,
people
a decir siempre
that are in the medical field are used to like knowing what prescription to give. But here there's no prescription and there's no recipe. And we don't have like a single patient profile. I believe that the good doctors are the ones that are able to look at that person they have in front of them as a person and work based on that. And I believe this is the same thing we're trying to do. It's just common sense. Like Descartes said, is the least common of all senses, right?
Efectivamente.
That's true.
Tratando, pueden ver ahí, hay muchas preguntas y creo que
Well,
también
there are a
conforme hemos
lot
ido
of
avanzando en la
questions, and I
conversación,
believe that as
varias preguntas se han
the
ido
discussion
resolviendo
um,
desde distintos
uh,
ángulos.
you know,
Yo
kept
quería
going, some of the answers were
hacerles
already
a
given to
todos
some of these
una
questions.
versión de la
But
primera
I
pregunta que
would like
recibí, fue
to
una
ask all
versión
of you a
que
version of
responde al hecho
one
de
of the
que
first
muchos temas se han
questions
abordado ya.
we received.
Si vamos a pensar en términos
And that is,
prácticos,
if we're going to
¿qué
think in
recomendaciones
practical
tienen para
terms,
poner en
what
práctica este concepto
recommendations
más
do you have
refinado
to
de
put
la
into practice
vulnerabilidad
this
a fin
more
de promover
refined
la inclusión
concept of
justa de
vulnerability to
todos
promote
en los ensayos
fair
clínicos y en las
inclusion of
investigaciones en general?
everyone in
No
clinical
sé quién
trials and
quiere
in research
iniciar,
studies
pero
in general? I don't know who'd like to
comencemos.
take it first, but let's start
Bueno,
discussing.
yo creo que,
Anna.
Perdón, perdón, Gloria y luego Ana.
Gloria,
Oh,
después.
Gloria and then Anna. Go
Ya,
ahead.
la más vieja primero.
Oldest first. Fine.
Definitivamente tenemos un problema de educación
Well,
en los
indeed, we do
investigadores.
have
Yo
a
creo que
problem
eso es uno de los
in
abordajes y
the
no sé realmente cómo vamos a
professional
enfrentar
background
eso,
of our
pero ese
researchers.
concepto de vulnerabilidad tiene que
But that
permear
concept of
lo
vulnerability
que el investigador, y es una cosa,
must be present in everything
eso,
researchers do.
y hay un concepto que no hemos hablado hasta ahora que es
And
riesgo
there's
y es
another concept we
verificación.
haven't
O sea,
discussed
ese
yet,
análisis de
which
riesgo
is
y
risk,
vulnerabilidad es obligatorio que
research
deberían
risk.
hacer todos los
And that
investigadores.
risk
Y que el momento en
vulnerability
que hacen su pregunta de
assessment
investigación,
must
es
be
que muchos lo dejan
done
es para el
addressed by
momento en que
everyone. A lot of
prescriben
people
las
leave that to the
consideraciones
very
éticas del
end by
proyecto.
the
Y ya
time
para eso entonces
they
es muy
talk
tarde.
about ethical considerations,
Entonces,
and
esa sería
it's
mi
too late.
introducción.
So that's what I wanted to say.
Adelante, Ana.
Anna, go ahead.
Pensándolo en la práctica, ¿no? Como creo
Thinking
que en la
about
práctica yo
in
aplico lo que
practice,
dice
because I
Florencia y
do
creo que lo
believe that
hacemos
in
en muchos
practice I
comités.
do what
En
Florencia said,
general,
and I
bueno,
believe that a lot of
volviendo a esto
us
también que
RIBs
dice
do
Gloria,
that.
¿no?
But going back to
Los
what
riesgos
Gloria
tampoco
just
son
said,
algo así objetivo y
risks
medible, ¿no?
are
Tiene que ver
not
con la
objective
población que
or
participa, con
measurable.
su
It
contexto
has to do with
y
the
para conocer
population
cuál
that's
es ese
part of the research
contexto hay que hacer
study,
ese
their
análisis
context,
fino
and in
de
order
las
to
capas,
know
¿no? que
about the
tienen las
context, we
poblaciones que
need
van a
to
participar.
really analyze
Sobre
those
todo a mí me pasa,
layers
por
that we
ejemplo,
talked
estando
about.
en un
What
comité,
happens
el
to
de
me
MSF, ¿no?
is that,
Es
for
un comité
example, I'm
internacional
in
en
the
donde yo no
MSF
conozco los países donde
um,
se hacen.
committee.
Necesito esa
I'm
información para
not
poder hacer un
familiar
análisis
with the
ético del
context of
estudio que
some
estoy
of the
realizando
countries,
porque
and I need that
no sé
context
cuál es la
to
vulnerabilidad de
do
la
an
población que
ethic
está participando. Por
review
ejemplo,
because I don't
recuerdo
know
que
where the vulnerabilities are.
en países
For
donde los derechos de las
example,
mujeres no
a
se respetan,
study
básicamente no se
in a
respetan o no los
country where
tienen,
women's rights are not respected
yo
or rather
desconozco cuál es el grado,
non-existent.
el nivel de
I don't
vulnerabilidad que
know
tienen, ¿no? Ahí
what
hablando de
degree,
una
what their
vulnerabilidad
degree of
social, ¿sí? Porque
vulnerability
creo que ahí hay una
they
pregunta, ¿no?
have. Talking about social
Vulnerables ante
vulnerability,
qué
right?
y
Because
vulnerables,
we had to
un
say
poco
vulnerable
este
to
concepto
what?
que trae Florencia, al
And
intentar sacar
like
esa
Lorenza
etiqueta
says,
va que, bueno, tenemos
if
grupos que
we
sí claramente
remove
son
that,
vulnerables de manera
tag,
permanente
because
por alguna
obviously
condición de
we have
salud, por
some
ejemplo, y
like
otros que no, que
groups
son
that are
contextuales, ¿no? Que son, digamos,
vulnerable
que
on
van
an
a
ongoing
cambiar según
basis,
el
and
país, según la
others
situación en
are
la que estén, mismo
context
dentro de un
based,
país. Eso, en
depending
Argentina,
on the
cuando hablo de estudios
country, or
de
not even
lugares que
within the country. In
desconozco porque no vivo
Argentina, for
ahí, porque
example,
yo vivo en
I'm
una ciudad,
reviewing cases
necesito más
from places
información,
that
porque
I'm
muchas
not
veces
familiar with
eso
because
no
I live
está
in
en
the
el
city.
protocolo,
So
muchas veces
I
los
need more
investigadores
information.
tampoco
Sometimes that's not in our research
son
protocol.
conscientes de que tienen
And
que darte esa
oftentimes
información porque
researchers
no es
not aware that they have to
información
give you that
quizás que
information
hace
because that's not
a la metodología del
information
proyecto
that's
o
related
cuestiones a las que
maybe
están
to the
acostumbrados. Entonces
project's
ahí es
methodology or the
un
other
rol muy importante
aspects
que
that
tiene el
they are
comité de
used
hacer
to
este análisis, ¿no?
include it.
De
So
ayudar y de darle
the
soporte a los
the
investigadores para que
review
ellos
committee has
puedan
to support
identificar, o
the
sea, hacer las
researchers so
preguntas
that they can
concretas, ¿no?
identify the
¿Cuál es la
information we
población?
need
¿Cuál es
and
el
ask the
contexto? Por
specific
ejemplo,
questions like,
si
what
se va a
is this
trabajar
population like? What are their
se me
vulnerabilities?
viene a la cabeza, no sé,
For example, I don't know, we're
trabajadores
going to work
sexuales. Bueno,
with, I don't know, sexual
hay
workers,
leyes
for
que los
example.
reprimen, se va a
Are
hablar del
there
aborto. El aborto es
laws banning
legal.
that or abortion? Is
Hay
abortion
distintas
legal?
cuestiones que van más
So there are a lot of
a la
issues
realidad,
that have to
contextual de los
do with
participantes y eso
the
un poco es este trabajo de
context
ir
in which these
desarmando, yendo a
participants
las
live. So
capas
we
y
need to
haciéndoles
kind of start
preguntas para
tearing
ayudarlos
things
también a hacer
apart
esta
and
identificación,
going
pero
through all the
tampoco
layers
como
to help them
pretender que los investigadores
identify what we need,
conozcan
because
todo
we
esto,
cannot
¿no?
expect
Entonces
our
es un
researchers
trabajo
to
de
be
guía igual
familiar with
tiempo,
all
creo
of
que ese
this.
es
So
el
it's a
rol que
two-way
tenemos como
street, and I
comité, ¿no? No
believe this
somos
is
alguien
the
que está
role that we
ahí
have as a
imponiendo la
committee.
ley y
We're
diciendo
not
esto es lo
there,
ético, sino que estamos
laying
para
down the law and saying this is
darles
what's ethical
soporte a
and
los
this is not,
investigadores,
but
invitarlos a
rather
la
we're there to
reflexión y el
support
pienso
our
sobre
researchers and
su
help them
proyecto. Entonces, claramente esto
think
se
about and
aplicó
reflect upon their
en la
projects. So
práctica y creo que
this
la
is
manera que
definitely
propone Florencia
something
es
that
una
we
manera
need in
muy
practice. And what
didáctica,
Florencia is
¿no? De ir pensando
suggesting
mismo,
is
haciéndonos las
is
preguntas necesarias para ir
very
desarmando
useful. That is to
y
say, to
viendo
ask
cuál es el grado de
the right
vulnerabilidad o cuáles son
questions
las
to see what
probabilidades que
the
tienen
degree
estas
of
personas de sufrir
vulnerability is,
daños, ¿no?
or what is the likelihood
Sí, yo
for
lo
these
que quería
people to
agregar, pero en
be
realidad
hurt.
un poco lo
There's
terminó
something I wanted
diciendo
to add,
también
but
Ana, que es
Anna
algo
kind of
que
added that at
por
the
ahí es
end.
como colateral, pero
And
que a
this might
veces
be like
no sé, en nuestros países o algunos comités
not
o algunas
directly
personas,
related, but
digamos,
sometimes in
ven
our
un
countries
rol
or some
como, se
committees
ven en un rol como muy adversarial
see themselves as
frente
playing
a
an
la investigador. Y a
adversarial
mí me parece que eso
role,
es
like you're
erróneo,
against the
que en
researcher. And
realidad
I
uno lo
believe
que
that
tendría
is
que hacer
wrong.
es, como
What we
comité,
should do
tratar de
as a
trabajar
committee
con,
is
por
to try to
ejemplo,
work
invitar al
with the
investigador
researchers. For example,
para
invite the
lograr que
researchers
ese protocolo
so
sea el
that
mejor protocolo
we can
posible,
make
el más
sure that that
ético
protocol
posible,
is the
pero
best and
no
the most
con el
ethical
dedito
protocol
y
possible,
diciendo
but
tienen que
not
hacer lo que a
pointing
mí me
fingers
parece
and
que está
say,
bien,
you have
sino
to
por
do
ahí
what I'm telling you
ayudándolo a
because this
reflexionar,
is right.
reflexionando con
But rather,
la
you should
investigadora y preguntándole, bueno,
reflect
¿por qué
with the
necesita hacer
researcher
esto? ¿Cuál es
and
la
ask, why
importancia?
do
¿De
you
qué
need to
manera?
do that?
¿Cómo lo
What's the
podemos mejorar?
relevance? How can
¿Tuviste
we
en cuenta
make
tal
this
cosa?
better? Did
¿No?
you
Me
take
parece
this
que
aspect into
también
account?
tiene que ver con una visión
I believe
como
it
un
has
poco
to do
menos autoritaria,
with
¿no?
being
De los
less
comités y
authoritarian
con
as
una visión
committees in
mucho
a
más
role,
como
and to
colaborativa,
rather
no
have a
desde la
much more
persona,
collaborative
digamos, a la que
role.
yo tengo que,
That is to say,
tengo en contra
the
que va a venir a hacer cosas
researchers
malas,
are not our
sino
enemies, that are
tratar de
doing
que haga lo
everything
mejor posible
wrong,
que viene a
but
hacer.
rather we
Quizás a
want them
veces
to
en
have
nuestros
the best
países se
version of their work.
predomina mucho la
Sometimes in
visión
our
de,
country,
no
we
sé,
have
la
this
compañía
opinion that,
farmacéutica que va
I
a
don't
venir a
know, the
hacer su
big
propio
pharma that's
beneficio.
going to
Entonces
come
hay como una
here
visión muy
to
sesgada y no
benefit
es toda
itself.
la
So there's a
investigación esa.
very
Y no
biased,
necesariamente también
view,
la investigación que
but
pueda
not
hacer
all
la
research
compañía
is like that.
farmacéutica per
And
se va a ser
not all
maligna
research by
y
big
para
pharma
lograr
is
beneficios
in itself
propios, ¿no?
going to be
Entonces,
evil
bueno,
and
es
for
parte
their
del
own
rol del
benefit. So
comité
that's part of the
entender
role
eso
that the committee plays.
y me parece que de esa manera
And
también
I
uno
believe
tiene
that
otra
that
visión
way
de,
you
bueno, cuáles son
also
las
have
vulnerabilidades que
another
están,
point of view of
cómo
what
puedo establecer.
vulnerabilities
Yo siempre hablé de
exist.
salvaguardas, pero veo
I
que
always
están
talk
hacia la
about
salvaguardia, pero
safeguards,
nunca supe bien cuál de las
Puede
dos
decirlo
era
de
la
but
dos
correcta.
formas.
in
Ah,
Spanish it can be
perfecto.
Tenido
said
esta
both
discusión, se
ways,
puede decir de
and
las dos
I don't know
formas en
which one is
realidad.
correct. Both are correct. We've
Genial.
had this
Yo
discussion
solamente,
before.
yo solamente, ay, perdóname, Florencia, sigue,
Sí,
sigue.
sí, sí, sí,
Go
no,
ahead, Florencia. I'm sorry
pero
for
era eso,
interrupting.
digamos,
No,
reforzar
that's all I
esta
wanted to
idea
say. Basically,
de
to
una visión
reinforce
como un poco más
this idea from
positiva,
a
¿no?
more
Y
positive
un poco más
point of
menos
view.
autoritaria y menos
Like I
saberlo
said,
todo,
less
¿no? Los comités,
authoritarian and
esto que
less,
decía Ana,
know it all.
tengo que ir y tengo que
It goes
preguntar y
back
tengo
to
que
what
conocer
Anna said.
cómo
I
es
have
esa
to go
población y
and
a veces
ask and get
los
to know
investigadores, las
about
investigadoras
this
saben más que uno
population.
y si
And a
no,
lot
hay
of
que
times
buscar
researchers know more
y
about us.
averiguar, ¿no?
And if
Pero
not,
eso.
we need to do our own,
Yo solamente quería decir
research.
algo chiquito para darle la
Uh,
palabra a Bernardo.
I wanted to say something very
Creo que
quick.
enfrentar el, y que es
This is
algo
Sarah
repetitivo
before
además,
giving the
que creo que
floor
enfrentar el
to
análisis ético es algo
Bernardo.
imperativo.
I
Lo tienen que
believe
hacer los
that
comités.
the
Ver el
committees
nombre, ¿no? De
have
una
to look
población
at
que
the name of
sospechosamente
a
ha podido tener este
population that
rótulo toda su vida no
has
es
been tagged
suficiente para
this
decir no,
way
mejor no
forever is
empecemos.
not
Entonces
enough
creo
to
que hay que hacer
say
las
it's better
preguntas,
to
creo
stay
que hay
away from
que
that. So I believe we need to ask those
desmantelar
hard
todas estas capas.
questions,
En el caso de personas
and
con
we
discapacidad, que
need
era lo que quería
to
decir,
peel through all the
con
layers.
discapacidad
And
mental,
in
la
the case
capa
of
no es
people with
esta
mental
capacidad de decisión afectada que podrían
disabilities,
tener y
which
a la vez todos estos apoyos
may
y
be impaired in
salvaguardas,
decision
que
making,
pueden
there's a lot of support and safeguards that can be put in place to minimize this vulnerability layer. Now, even though the convention has existed since 2008, apparently this has not um, permeated a lot in research, and it's very important to have communities in better communication with each other. For example, how those supports and safeguards could be implemented because they may be from changing the language or having videos to much more difficult changes that may require legal approval. But I like to give Fernando a chance. Going back to how important inclusion is, like Florencia and Ana said, there shouldn't be a confrontation between researchers and committee. Our impression after this review is that there wasn't a whole lot of reflection on the concept of vulnerability, even in projects where you would expect that because of the type of population that would exist. And maybe it's because researchers are kind of afraid of facing that because once they include that in the project, just because they mention that they're dealing with a vulnerable population, the committee is going to turn them down. There was one project that was interesting because they took the concept of vulnerability as grounds for research in that group, and we could identify reasonable safeguards. So they handled it very well. I wish a lot more would do it that way.
Era un proyecto sobre qué, perdón.
What kind of project was it, Bernardo?
¿Te acuerdas?
Do you remember? Let me think. I believe it was with seniors, and it said that it was a group that had not been extensively studied. It was something like that. That's interesting because in the past, all research protocols said that the population in a study was people between the ages of 18 and 65, excluding pregnant women. It was very, very rare unless it was a research project on children. The majority of the research studies was 18 to 65, excluding pregnant women. And research, ethics committee would say, okay, so I believe the main shift or paradigm shift rather in terms of understanding the concept of vulnerability and what it means in practice to promote responsible inclusions, enabling all populations to benefit from research is that now the default position has changed. And this might be something small, but maybe we can all commit to doing this in our RIBs or when we're researchers. So, for example, if we get a protocol that excludes, for example, over the age, under the age of 18, we can ask why. What are the grounds for excluding people under the age of 18? I fully agree with what was said before. We tend to stay away from having this conversation between the IRBs and researchers. Sometimes, as a research committee, you realize that the researchers had a great reason for doing something, but they did not include it in the protocol. But I believe that if we start changing that practice and asking why have you excluded this population, we start discussing specific aspects with a level of detail that we've all said we need in research ethics. And we're taking a step forward to make sure that more populations benefit from research studies where they can be participating and provide knowledge for. We are a minute away from running out of time, so thank you so much, everyone. I would like to reiterate my invitation for, We are here in
Quiero
the
reiterar la
bell.
invitación de que se
I would like
sumen
to reiterate
a
my
la
invitation
red
for you
de
to
investigación
join
ética de la OPS para
the
recibir la
PAHO's
invitación a nuestro propio próximo seminario
network
que será
so
el
that
2
you
de
can
diciembre
receive our
sobre
invitation
temas de
for our
ética,
next seminar
revisión ética
on
en
December
inteligencia
2nd,
artificial
which would be
y,
ethics
bueno,
review
además para
in,
recibir otros recursos
IA,
y
and also
oportunidades
to
que
receive
tenemos. Ha
additional
sido
resources and
muchas preguntas, mucha
know about
reflexión
other
y
opportunities. There's been a lot of
bueno, estamos
questions, a
muy
lot of
agradecidos por su
reflections, and
participación,
we're very
tanto a
thankful
quienes
for
nos
your
han,
presence. And this goes
se han
to
sumado a la sesión como
those who
nuestra
joined us as
presentadora y nuestros
participants, as
panelistas.
well
Muchísimas
as
gracias
our
y que tengan
presenter
un
and
buen fin de
panelists.
semana.
Thank you very much and have a
Gracias a
great
ti.
weekend.
Gracias.
Thank